Okay, can you see the? All right. Nothing like running late. Mad dash. Okay, let's see. Good morning, guys. How is everybody today? All right, so I didn't talk about this on Monday. I forgot, so I made you in charge. CPR is not required. Let me turn this on here. Oops. CPR is not required for the test. It's not required for the class. It is required in most places for work. So, sign. Okay. Hold on, I'm setting this up, guys. Hold on one second. Sometimes my camera, for whatever reason, doesn't connect here. So I gotta set this up. Okay. Okay. Let's go back up here. There we go. All right. So CPR, not required for the test, not required for the class, will be required to work in most settings. You don't have to get CPR with us. You can get it anywhere. I would suggest that you get it through American Heart because that's what most employers require. We do have a class on Saturday at 9 a.m. and in week 4, Monday afternoon after class. So I have 2 CPR sessions while you guys are in class. Saturday at 9, you don't have to pre-register, just show up. Or the last Monday of class at 2. Good? While you're enrolled before graduation, those 2 dates, we offer CPR for $45. After you graduate, the cost goes up to $55. Okay? Good? So I just wanted to remind you, we will have CPR this Saturday. All right. Okay. So did you do the reading for chapter 1 and take the test on page 181? Okay. Did you grade the test using the answer key? Okay. When I call your name, if you can tell me either how many you missed or what your score is based on the grading scale here. On page 201 is the grading, the answer key. Page 201 is the answer key. Page 181 is the test. Okay. And then tonight, you're going to have 2 chapters of homework between now and Monday. Do you need help?
Back and forth.
Oh, no. I'm happy to help.
Yeah.
So page 201 is the answer key. So you just go back and forth to grade it. If you don't have it graded or if you didn't get to it, just say pass and I'll come back to you next week. Anytime I have blanks on here, I just keep going back to it until I get them filled in. So it's a no stress class. Victoria?
90.
Thank you. Janelle? Elizabeth?
85.
Thank you. Zachary?
100.
Thank you. Kiera? Paula? Neftali? Isabel?
85.
Okay. Andrea? Cassidy?
80.
Thank you. Yazelle? Uh-oh. Lacey?
95.
Thank you. Queenie?
85.
Thank you. All right, did I get everybody? Did I miss anybody? All right. Anybody have any questions on what you missed? Anything you want me to explain to you? Anything that you missed and you don't know why? Yes.
The number 8.
Okay, let me go to page 181 real quick. Okay. So let me go back here real quick. So this is number 8, right here. A person assigned by law to be a legal advocate for a patient is called. So they want to know what that term is. Good morning. They want to know what that term is. The term is ombudsman, but let me explain to you why and what this is all about. Okay. So when you are at somebody else's mercy, so if you're in a nursing home or an assisted living facility and that's where you live, okay, you don't have anywhere to go. So if they don't treat you well, you're kind of stuck. This is where you live, right? Make sense? So if they complain, so let's say we have a CNA that's treating somebody really roughly, okay, picking them up, putting them in the wheelchair, they're bruising them, it's just real rough, and like there's no compassion there, right? That patient may not feel comfortable complaining because who are they going to complain to, right? They have to complain to this person, this CNA's co-workers. So how far do you think they're going to get, right? It's a very uncomfortable position for them because they may fear retaliation. So let's say that you're really rough and I am the patient and I complain to you, hey, she's really rough with me. Now, he could go to administration and let them know, and that might solve the problem. Or he could go to her and say, you know what? She's complaining about you. And now she's going to treat me even worse. Does that make sense? Do you guys understand how that could be a really bad situation for the patient? And it may restrict their ability to advocate for themselves because they're at your mercy. So that's what an ombudsman is. It's a third-party person, does not work for the facility, does not work for the patient. It is a volunteer position. Somebody from the community that comes to the facility and is able to hear complaints. Good morning. And then they take those complaints to administration and they monitor to make sure there's no retaliation. So now the patient has an opportunity to be able to advocate for themselves without fear that people are going to hold their food trays and starve them. And yeah, that does happen. Or be extra rough with them. And that does happen. So we need this ombudsman position to help keep everything very equal across the board. Because when you have a dependent patient, it's automatically not equal. The dependent patient has to depend on staff, which puts them in a position of power. Does that make sense? So that is an ombudsman. Now, ombudsmen are volunteers. They don't get paid. And that's important because now they are truly working, if they're volunteers, they are truly working in the best interest of that patient, not the people that are paying them. Make sense? Okay. So that's what an ombudsman is. So does that clear that up a little bit? Any other questions on chapter 1?
Actually, it's more of a statement number 3, yesterday you were telling us that touching a resident was battery.
Mhm.
In the book, it says that it could be harassment as well by touching a patient.
Okay, yeah, I'm not a big fan of the yellow book. The legal term is battery, but harassment is generally verbal. Okay, so there is a term, harassment, but it's generally verbal. So, anybody here have siblings when you were growing up? Siblings? Now I'm an only child, so I can only assume that this happened based on TV and stuff like that. Okay, I didn't have siblings. But when you were a kid, did you ever have a sibling that did something like this? I'm not touching you. I'm not touching you. I'm not touching you, right? Just doing something to really get under your skin and aggravate you, but not really enough that they could get in trouble for it, right? They didn't hit you. They didn't touch you. Mom really can't say much, but just something to get under your skin. That's harassment. Things designed to get under your skin that aren't technically not allowed, but they're done in excess to give you basically a hard time. That's harassment. Okay. Battery is touching somebody without their permission. Now, that question is not going to be on the state exam. Not at all. They don't ask you to differentiate between battery, harassment, sexual abuse, neglect. They don't ask you to differentiate between those terms. What they do want you to know is that certain actions that we sometimes take when we shouldn't can result in legal action against us. So putting a food tray in front of somebody that can't feed themselves and then taking it away and marking that they refused, that's horrible. That's torture. And it's illegal. And it should be. It absolutely should be. Hitting a patient, that's illegal. And it absolutely should be. If I walk up and slap you right now, there's going to be a consequence to that. It doesn't matter whether the person is able-bodied or dependent. It's still illegal. Does that make sense? So they're not going to ask you about those terms, but they may give you a scenario and ask you, is this basically okay, or is it battery? These terms get really, really gray area when you get into legal. So you guys have all heard of sexual battery, right? But there's also sexual harassment. What's the difference and where does one bleed over into another, right? Does that make sense? So these terms can be very fluid, very fluid. They don't ask you to differentiate between the terms. They're looking for you to identify actions that are wrong. Good? Good. Okay, so number one, it often gets missed. So number one is, what is an example of neglect? It's on page 181. What is an example of neglect? And there's 4 choices there. Tying a patient to a wheelchair. That's actually false imprisonment. Right? If I tie you to the chair that you're in, it's not neglect. I'm not neglecting you, but I am imprisoning you without your permission. That's false imprisonment. Not locking a wheelchair prior to transferring. That can result, that's an absence of an action that can result in injury. Okay. So that might be, neglect is an absence of an action. So let's come back to that one. Slapping a patient. Well, slapping a patient is an action, not an absence of an action. Neglect is always an absence of an action, necessary action. So slapping a patient is abuse. And following the care plan exactly, well, that's what we do. That's not a bad thing. So let's go back up to 2. Not locking a wheelchair prior to transferring. Good morning. So we said that could be maybe the right answer because neglect is an absence of an action. We don't know at this point. Come on in. We don't know if this is a required step or not. We don't know, but we know that the other three are not correct. And that's what makes B correct. Now, that process that I just went through is important for you to know because on the written test, you may have to eliminate some answers. No, slapping a patient, that's not neglect. Remember, neglect is an absence of an action. That doesn't work. Following the care plan, I'm supposed to do that. That's good. So we can get rid of that one. Tying a patient to a wheelchair, that could be. So let's, kind of evaluate between A and B to figure out what the right answer could be. So that process of elimination is important for you. And the ebook that I told you about yesterday or Monday, that ebook leads you through that whole process. It dissects a whole bunch of questions and answers and helps you evaluate to find the right answer. That ebook will help you if you struggle with written tests. Okay. So any other questions on chapter 1 test on page 181?
Number 7, where it's talking about the name of the law that keeps the patient's health information.
Okay.
I thought it was HIPAA. It's to do with patient.
It is. Yes. 7 should be B. Is it not?
No, it's ORBA. ORBA, whatever. How you say it.
If you look at the answer key, you'll see that 7 is B. So you may have misread it.
I did.
Yeah, you're absolutely right, though. HIPAA is the law that keeps all health information private. HIPAA just came around in like 1996. It's relatively new in the history of healthcare. Used to be, now I'm very old. I remember when we didn't have HIPAA. Neighbors would call up the hospital and say, "Hey, I'm Susie Q's neighbor. How is she today?" And we would say, "Oh, she's just fine. She ate well. She's got this test today. We expect her to be discharged tomorrow." We had no idea who this was on the other end of the line. We have no idea what they're doing with this information. You have the right to control the information pertaining to you. But way back then, we didn't verify anything. We would tell anybody anything when they asked. And that's why HIPAA was enacted. Because this really affected celebrities. Can you imagine going to the hospital for something that's embarrassing and having it splashed all over the tabloids because there was no law to keep your health information private? Can you imagine that? And no penalty for it. So let me explain to you how distressing this can be. Okay. We actually just had a lawsuit on this about 3 years ago, maybe a little longer. I lose track of time. There was a major basketball player who was in a helicopter accident with several other people and his daughter. The first responders on the scene took pictures with their cell phone and then sold those pictures, distributed them to people who had no need to see just because it was a celebrity. Now, can you imagine the horror that family faced? Would you want, in a catastrophic accident where 2 of your dearest loved ones just died, would you want people showing those pictures around for entertainment? So those people were prosecuted. And I think that is correct. They should have been prosecuted. Your tragedy is not for my entertainment. And that's really what HIPAA is all about. Does that make sense? So the best advice I can give you with HIPAA, don't share anything with anybody that doesn't need to know. at any time. Period. End. Full stop. A lot of people are now, a lot of healthcare workers are now on TikTok going live from their facilities making fun of patients. Should we be using their tragedy for our entertainment?
No.
No, absolutely not. Do not go live. Do not tape. Do not do anything social media related from your facility unless you're expressly permitted to do so by administration. Ever. It's not for your entertainment. Does that make sense? That's horrible. If my grandmother showed up on TikTok, God help you. Because my grandmother does not exist for your like count. That's my grandmother, not yours. Does that make sense?
Yeah.
And other people feel the same way.
I have a question. I work in memory care,
Mm-hmm.
and then, for example, number 20 just died, and then there was a resident. The family of the resident of number 1 asked me, like, "Hey, I didn't see number 20 anymore." I said, "She just died last time. Is that HIPAA or is that correct?"
So this is a gray area, and I would really, I'm supposed to refer you to a lawyer for this, but the supposition of privacy even supersedes death. So, and like I said, this is kind of a gray area, but I personally, in your situation, will refer that to the nurse. I'm not sure what happened. Let me get the nurse for you. Okay, let the nurse, because I guarantee you at that facility, wherever you're at, there is a policy that tells us how to handle that. We may tell them that, I'm sorry, we're not allowed to talk about other residents. It's probably the most common policy. The patient may have transferred out. I'm not sure. That's another potential answer. But generally speaking, we don't. So here's the reason. Okay. Now, number 1 may have been very close with number 20, right? They may have played bingo together. They may have gotten their nails done in the nail salon together. They may have formed a very close friendship. Okay. So the family of number 1 asks, "Hey, what happened to 20? I don't see her around." And somebody says, "Oh, they died." Well, their next question is, why? How? What happened? Yeah. So they're going to ask a lot of details, right? What they're asking is, was it contagious? We live in the era of COVID. So my mom is very close friends with number 20. What did she die from? Is my mom at risk? So now we're passing on sensitive personal information. So you've got to be careful about answering questions as a CNA, because on the other end of that question is always another question that's going to get you deeper and deeper and deeper. Same thing with vital signs. Patients will ask, "Oh, what was my blood pressure today?" If you answer that question, there is another question on the end of it. "Oh, is that good? Is that okay? Well, what does that mean?" You can't answer those questions. Those are diagnostic questions. You can't answer those questions. So your best bet is to not even answer the first one. "Oh, I don't know. I just work the machine. Let me get the nurse and she can give you the information." Because the nurse is the one that has the answers that patient needs. Does that make sense? Be careful about answering patient questions, because it's like potato chips. They never stop at just one. Ever. Ever. So be careful about questions. Good? Make sense? Okay. So yeah, in that case, I'm not saying that what you did was wrong. I'm not saying that. But in that case, I probably would have referred them to the nurse and let the nurse figure out how to handle that. Because remember, questions are like potato chips. There's never just one. Okay. Good. Anybody ever try to eat one potato chip?
It don't work.
It doesn't work. No, it does not work. Lay's has it right. You can't just eat one. All right. Any other questions on what we went over? on the reading. Any other questions? All right, let's see if we remember what we learned on Monday. So this is going to be a review of what we went over on Monday. And we're going to do this review at the beginning of each class for the first 2 weeks. Okay, so you're going to see these slides again and again and again and again and again because they're important. And I've got to make sure that you get these concepts. So by the end of week 2, you're going to be like, all right, I got it. And that way I know you've really got it. Okay. So how do we know what to do with each patient? We perform the skill as directed on the care plan. We're going to follow the care plan, the whole care plan, and
Nothing but the care plan.
nothing but the care plan. While we're doing that, we're going to make observations. Very good. Remember, half of our job is to observe and report. Who are we going to report that to?
The nurse.
The nurse. Very good. Every skill starts with an opening. What does every opening start with? A knock. Once we knock and enter, we're going to greet the patient. Yeah, not the housekeeper, not other staff. No, it's all about the patient. So we'll greet that patient. But specifically, how do we want to greet that patient? By name, absolutely. Now, let me stop here for a second and talk to you about name. I'm a Southern girl. Born, bred in Florida. I am a Southern girl. I do not call anybody that's older than me by their first name. That's just bred into me. So I won't call Cliff. I will call him Mr. McGillicuddy. Okay? Until he says, oh, you can call me Cliff. And I'm still not going to call him Cliff. I'm going to call him Mr. Cliff. Good? Make sense? You don't have to do that. You can call patients by their first names, but there's a problem here. I think that our society has become a little too informal. I need a level of separation here. I am not Cliff's friend. If I were Cliff's friend, this would be awkward, what we're about to do together. There needs to be an emotional separation that puts me in a category of professional and him in the category of patient for this to be not awkward. Does that make sense? When you start calling older people, particularly patients, by their first names, it muddies that separation. And it can make things very uncomfortable for both you and the patient. So for me, I don't call patients by their first name. I won't call Opal. I'll call her Miss Opal. But I will call her Miss Hayes until she tells me otherwise. I prefer to use last names. Again, it's that professionalism. How do you want to be known in your craft? As a professional or just as somebody that's showing up and filling a spot? That is entirely in your control. Does that make sense? When you start acting professionally, it's amazing how other staff members start treating you like a professional. Okay, so that's a big part of this. So we're going to address our patient by name. So in here, you'll always hear me use Mr. or Mrs. Jones. I don't use first names. Okay. So we're going to address the patient by name. And then what do they need to know about us?
Our name and title.
Our name and title. Yeah. And again, I don't like the familiarity here. I don't like people to call me by my first name. I think that there should be a level of professional separation. But unfortunately, our industry kind of has made this the norm. And people knowing your last name can get a little creepy when you're a caregiver and they want to look you up. So I will introduce myself as Patty. I don't like it, but I'll do it. Now in here, I refer to myself as Miss Patty. again, that professional separation. Good. In a clinical setting, I usually refer to myself as Nurse Patty. I want that professional separation. Okay. Now that we've got all those formalities out of the way, knock, knock, knock. Hi, Miss Jones. My name is Patty, and I'm your CNA today. What do they need to know? Yeah, what are we there to do? So you can read it right off the care plan. You can summarize it in your own words, but you got to give them a clue as to what you're there to do. We do a lot of skills. They need to know which one we're doing right now. And then we're going to ask the most important question in healthcare. What do we need to get? Permission. Absolutely. Now, what do you think you should do if they say no? Stop. Yeah. So remember that we are the hands and the feet of the patient and the eyes and the ears of the nurse. Everything that we know, the nurse should know. So if a patient refuses a skill, what do we need to do? Report it to the nurse. It's not up to us to solve that problem. Not our job. You're starting to see why nursing education is so long. We got a lot to learn. But we're going to obtain permission. If we can't, we'll report it to the nurse. All right. Once we've done all that, what do we want to close?
Privacy curtain.
The privacy curtain. Yeah, everybody deserves privacy. Absolutely. There is one skill that we do not close privacy curtain for. We'll get to that a little later in the program. But everything else, we're going to close that privacy curtain for. And then once we touch that curtain, is that curtain clean?
No.
No. So what do we want to do?
Wash my hands.
Yeah, get rid of those cooties. Absolutely. And now that we have clean hands, we can go get our clean supplies. Yeah. The most important part of the opening is that we don't touch our patient until we have clean hands. Good. Quickest way to fail the state exam. Now, interestingly enough, remember I said that our program is based on Prometric standards. That's who you're testing with. It's based on Florida, right? And I'm doing this huge research project on all other states' testing checklists. Interestingly enough, not all states adhere to this. It's kind of scary, isn't it? Would you want to be a patient if somebody's touching you with unclean hands? So this is part of what I'm doing is I'm providing a report to all the states about each of these standards. So, but it's interesting, not all states adhere to this, but Florida does. And it's the right way. All right, so that's how we start every skill. So every skill, hi, Miss Jones, my name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands, get supplies. Good? Now, every skill is going to end exactly the same way with the closing. So what kind of environment do we need to leave our patient in? A clean environment. Yeah, so we want to look around. Are the sheets nice and neat, or are they all jumbled? Is our patient in a safe place, like the middle of the bed? Is the bed in the low position? You know, all of those things that we want our patient to look good and to be safe, right? So we want to look around. Now, I'm going to tell you that for the test, the biggest thing that CNA students forget is that as we go through this, we're going to get into this a little bit later today, but we're going to be using barriers on our table. And a lot of times, CNA students will forget to get rid of that barrier. We can't leave it on, can't leave it on the table after we use it. So when I say clean and safe, I'm also talking about make sure your table is clean, uncovered. Everything that we used in the skill has been put away or disposed of. Good? Clean and safe. All right. Here's a good tip. Always leave your patient looking better than you found them. That's the mark of a good CNA. If you go into a room and you do something to improve that room every time you go in to leave your patient looking better than you found them, you are a good CNA because you're making it all about the patient. Okay. So what position does that bed height need to be in before we end the skill?
The lowest.
The lowest position, yeah. Remember the floor? You don't want to move the floor. Good. Good. All right. What do we want to ask them?
Are you comfortable?
Are you comfortable? They need to hear that word. Are you comfortable? But are we going to stop at physical comfort? No, we need to focus on both physical and emotional comfort. So while we're asking them, are you comfortable? And that's going to include the head of the bed. They might want to sit up to watch TV. They may want to lay down to take a nap. You know, that's all part of comfort. But we also want to offer a magazine. So we're going to address preferences. So does the head of the bed need to go up? Do you want a magazine? You know, are you comfortable? Emotional and physical we're looking for here. Okay. And then I didn't go over this on Monday. Your patient, if they're in bed, needs to be covered with a sheet, with clothing, with a blanket, with something. If we've got a patient laying in bed in a hospital gown and they're not covered, they're uncomfortable. Their knobby knees are showing. They're uncomfortable. So make sure that they're covered. If they're dressed, they're covered. If they have a sheet on, they're covered. But don't leave a patient laying in bed in a hospital gown with no covering. Okay. We're going to, once we've done all that, somewhere in there, we're going to open the privacy curtain. We also need to give the patient their call light. So all of those things, there's a lot of steps there. Look at all those steps. We don't care what order you're doing. Knock yourself out. But I would put this in some sort of an order that you can kind of go through every time. Comfort, curtain, call light, clean. Okay, that way you get them all. Okay. Comfort, remember physical and emotional. Curtain, I got to open that curtain. Call light, they got to have a way of calling me once I leave. Clean environment. Doesn't matter how you do those things, just make sure all of them are done. And once you've done all of those things, then you're going to go wash your hands. Absolutely. We got to get those cooties off. Now, if we have to document, remember for the test, you will have one documentation skill. If we have to document, when should we document? When should we document?
After you wash your hands.
After you wash your hands, because this pen goes home with you at the end of the day. Do you want to touch this with cootie covered hands?
Mm-hmm.
No, because then you'll have cootie covered pen. And that goes home with you. And remember, these germs that we're working with are bad enough to make somebody sick enough to not be in their home. Do you want those germs in your home? No. So always make sure that you have clean hands when you document. And then our standard is that we have to end skill with clean hands. So if we've documented, what's the next thing we have to do? Wash our hands again. Okay, good. Questions? So we have to make sure that we end our skill with clean hands and we have a safe patient who feels cared about. It's not enough to just go in and do the physical aspects of caregiving. Our patient needs to feel like they're cared about as well. Okay, good. Questions? Oops. What happened? Okay, I have a slide malfunction. Okay, let's talk a little bit about hand sanitizer here. So for hand, and that's what this slide is supposed to be. So when we're talking about hand washing, it doesn't always have to be hand washing at the sink. Get your hands wet, put soap on, scrub for 20 seconds, move on to your nails, clean under your nails, rinse your hands, being careful not to touch the sink or the faucet, dry your hands, throw those away, clean dry paper towel to turn the faucet off. We don't have to do all of those steps all of the time in a clinical setting. In a clinical setting, for the tests we do, but in a clinical setting, a lot of times we'll be using hand sanitizer. Okay. But if we're going to use hand sanitizer, there's some rules. Now, how many of you guys have ever used hand sanitizer? Absolutely. Normally, we do something like this. We get a little bit in our hands, we rub it together, and there we go. Right? That's how we use hand sanitizer. And if you've got the good stuff, it smells good. But there's two problems with that. The first is that is not long enough to kill the pathogens on my hands. In order to be effective, I've got to use enough hand sanitizer. Notice it's a whole lot more than I used before to keep my hands clean for at least 20 seconds. Keep my hands wet, sorry. For at least 20 seconds. That's a long time. 20 seconds. So let's see how long 20 seconds is with hand sanitizer. How many of you guys have ever used hand sanitizer this long? Okay, that's 20 seconds. If your hands are not wet for that entire time, you are not using hand sanitizer correctly. So that means that we have pathogens that are surviving what we're throwing at them. And anything you survive makes you stronger. This is how we are developing resistant bacteria because we're not utilizing things properly and we're leaving survivors. Good? Makes sense? Let's talk about hand sanitizer for a second because most people don't really understand this. This little guy, his name is Johnny. Isn't he cute? This little guy, and I'm guilty of this too, by the way. Okay, I'm going to tell you I'm guilty of this too. If I'm going to go have lunch somewhere and I'm going through a drive-through, now I've touched a whole bunch of stuff, so I'm going to grab some hand sanitizer, rub it on my hands, go through my drive-through, order my value meal, whatever. I'll get it, and I'm going to grab some fries out of the bag as I'm driving and shovel them in, right? Because I think I have clean hands. Well, when I use hand sanitizer, well, let me back up. When I go to the sink and wash my hands, where do those germs go? Down the drain. So I'm starting with actually clean hands. Now, when I use hand sanitizer, where do those germs go? You didn't really think about that, did you? Right? They didn't pop into the atmosphere and disappear. No, they are still on my hands. I have carcasses, dead pathogens on my hands. And I don't know about you, but eating fries with a side of dead E. coli isn't as much as it's cracked up to be, right? So when you are going to bring your hands up near your face, eating, drinking, smoking, cell phone, scratching, right? If you're going to bring your hands up to your face, it's best to wash. Does that make sense? It's best to wash. And if you are going to use hand sanitizer, make sure that you use it for the appropriate amount of time. Now, there's two things that hand sanitizer does not fix. And one of those is C. diff. The other one is norovirus. So if we are working with just garden variety pathogens, we use hand sanitizer, it kills them, it's fine. They're dead on your hands, but they're dead. But when we're working with norovirus, now norovirus is called the daycare disease or the cruise ship disease. This is the stuff that makes everything come out of both ends for 3 days, right? You don't want this. This is really crappy, pun intended. Okay. Norovirus is not killed by hand sanitizer. It has a protein envelope around it that this does not penetrate. So if you eat and you have norovirus on your hands, you will contract it because it's not killed by hand sanitizer. Now, either C. diff. C. diff is way worse than norovirus. You know how norovirus, both ends, 3 days? C. diff is one end for 6 weeks. It doesn't end It'll deplete your system and it could very well kill you. It's pretty nasty stuff. So when we're working with C. diff patients, hand sanitizer is not your go-to. You need to be scrubbing your hands at the sink. Good? Makes sense? We're probably going to have you wear an isolation gown too because those spores can stick to your clothing. Yeah, be pretty gnarly stuff. All right. So we've mastered these 3 principles. Congratulations. You're off to a good start. So if you look at the 11 on the back wall, we now know 3. Today, we're going to learn 3 more. Okay. Everybody good so far? All right. So we're going to learn our first skill now. So if you go to page 52, the first skill that we're going to learn is measure and record radial pulse. Good morning, Caitlin. Yes, I'm sorry. Paula, right? Okay. So Paula, you'll probably want to watch the replay from Monday's class just to kind of get caught up. And it's on our YouTube channel. It's also in the course as well. But watch the replay. But we just reviewed most of it. Okay. So 4 hours of content in 20 minutes. All right. So any questions before we get into our first skill? No? All right. So page 52 in your book. Gives you an overview of measure and record radial pulse. So we talked about this a little bit on Monday, how the book works. So here you'll see the principles involved. So we know we have to follow the
Care plan.
every skill is going to start with the opening. We know we're going to do the closing at the end, and we need to learn glove rules. Okay. So we know the skill rules, opening and closing. We need to learn glove rules and the specifics of the pulse. That's what we're going to concentrate on now. Okay. I have a video on this you can watch. It's on my website in the course. And down here, you'll see test-specific information. They're giving you, somebody with your level of experience, which is none, 5 minutes to do this skill. We're counting the pulse for 1. They're giving you 5. They always give you way more time than you actually need. So don't rush. That's the biggest thing here. Don't rush. Okay. This is going to be done on another testing student. So that means you might be the patient for this skill during the test. You're going to be laying in bed. Yeah, so this isn't a chair skill. So when you're practicing this at home, you need to find a live person and throw them in the bed. Okay? To practice this as if it were the test. Now, that doesn't mean that you can't take a pulse with somebody sitting in a chair. You can. You can take a pulse with somebody standing up. You can even take a pulse with somebody standing on their head. Don't recommend that, but you could. Okay? But that's not how it's going to be set up for the test. For the test, your live patient will be laying in bed. So if you want to practice like a dress rehearsal for the test, this is what you want to pay attention to. All right. Questions on that? So we know skill rules, we know the opening, and we know the closing. So now let's learn glove rules. Now, glove rules are going to be, just like the other 3, they're going to be featured in every single skill. And that's because no matter what skill we're doing, we've got to evaluate if gloves are needed. Okay? So you can see this on page 40. You'll see that glove rules are part of every single skill. If you look here, you can see every skill listed. And I have a video on this, of course, so you can watch the video. I'm not going to show you the video. I'm going to talk to you. This is what we call the big four. Skill rules, opening, glove rules, and closing are part of every single skill that we learn. So let's get into, okay. So let's get into glove rules. So everything I'm about to tell you is on page 41. Those are your notes. Remember that I always give you the notes for everything that we're going to go over. Okay? But in order to understand gloves, I've got to teach this to you in a way that has nothing to do with medicine. Because once we start talking medicine, your brain gets all scrambled. So I'm going to explain this in a way that has nothing to do with medicine. We're going to build a sandwich. Okay? How many of you guys have ever gone to a place where they built a sandwich in front of you? Yeah. You don't want them touching your sandwich while they're building it, do you? So what do they wear?
Gloves.
Gloves, absolutely. So let's build a sandwich and see how useful those gloves are and why you want them to wear gloves. Okay, so let's go through this. Okay, so you come up to the counter and I put on gloves and we're ready to start the sandwich. The first thing that we need is bread. So what kind of bread do we want? White, wheat, cheese, Italian? Italian. So I'm going to go into this bread holder and grab a loaf of Italian bread, and I'm going to set it down on the counter. And when I set it down on the counter, I'm going to take the knife that's laying there and cut it in half and fold it open. Everybody with me so far? Right? Sounds about right. Okay. So do we want mayonnaise on there?
Yes.
Sure. So I'm going to, this is all messed up. Hold on. Okay. So I'm going to grab the mayonnaise spreader that's always kind of hanging out in that mayonnaise tub, right? So I'm going to grab that mayonnaise spreader and I'm going to spread the mayo on the bread. Put the mayonnaise spreader back in the little tub thing. So what's the next thing that we want? Maybe some other sauces like mustard, honey mustard. So what do we want? Honey mustard. So I'm going to grab that container, tap it on the counter, and squirt some honey mustard on there. Sounds like a good sandwich so far. So we're going to put some honey mustard on there. How about some bacon? Oh, everything's better with bacon. So let's put a couple slices of bacon in there. So I'm going to get the bacon wrapper, you know, the little thing that holds the bacon, open it up, grab a couple slices of bacon and put it on there. I'm hungry. I didn't have breakfast this morning. What kind of meat do we want? Ham, turkey, salami. What do you want? Ham. Okay, so I'm going to open up. Oh, you want salami too? Okay, that sounds like a good sandwich. So I'm going to open up the refrigerator and I'm going to grab out the ham and the salami. And we're going to take the little wrapper things off and throw them away and put the ham and the salami on the sandwich. So far, so good. How about some cheese? Cheese? Okay. So we're going to go to the drawer where the cheese is. And oh no, what kind of cheese do we want? Cheddar? Cheddar? There's no cheddar. Oh, that means I got to go to the cooler and get some. So I'm going to go open that cooler and then I have to slice that cheese. So I'm going to use the slicer and get my cheese and put the big chunk back in the cooler. And then I'll put my cheese on the sandwich. Do we want that toasted? It's got bacon on it. It probably needs to be toasted, right? So we're going to ask to have it toasted, but right now the toaster's a little busy. So we're just going to kind of stand there and wait a second for the toaster. When it's our turn, we'll put the sandwich in and we'll touch the controls to turn it on. And we'll wait until it dings. And then we'll get that little paddle thing and pull it out, right? Put it back on the counter. Well, now we're ready for the topping. So lettuce. So I'm going to reach in that little bin of lettuce and put that on my sandwich. How about some tomato? Do you want that tomato chopped or in slices? Slices. Okay, so I'm going to get the tomato slices and lay them on the sandwich. How about, do you want olives, pickles? Pickles, the garlic pickles? Oh, those are good. So I'll get those, kind of drain them out, put them on top. Anything else? Onion, pepper, Anything else? No. Oil and vinegar. So I'll get the oil and vinegar and squirt that on. How about salt and pepper?
Yeah, sure.
Okay, so we're going to get the salt and pepper shaker and shake that on. Yeah, and then we're going to grab that knife again, shove it in the sandwich, and fold that sandwich over to cut it in half. And then we've got to put it in our wrappers, right? Wrap each half up and then in a bag, and then type in what it is so we get the sticker, and then I can hand it to you. Yeah. Did those gloves do what you thought they were going to do? You wanted them to wear gloves, didn't you?
But touching everything. Different
Okay.
things.
So you wanted them to wear gloves so their hands didn't touch your sandwich, but you didn't pay attention to what those hands were touching with gloves on.
They're supposed to change them every time.
Okay, so what did those gloves touch? Let's go through this really quickly. It touched the bread cart, the knife, the mayonnaise spreader, sauce bottles, the outside of the bacon package, the cheese drawer, the door handle, the containers inside the cooler, the slicing machine, the table, the toaster oven controls, the paddle, the lettuce, tomato, and other toppings, and the wrapper. Were those gloves effective?
No.
Well, it depends. Who are we trying to protect here? If we were trying to protect the sandwich worker, they're pretty effective.
But now you're eating all of them.
But your sandwich was not protected. So when we're talking about gloves, what we really need to know is who were those gloves there to protect? Right? If they're there to protect the sandwich worker, yes, they did a great job. If they're there to protect your sandwich, they did a horrible job. Does that make sense? So are you guys starting to see that gloves may not be the answer you were thinking it was? Because we do this in healthcare all the time. We put gloves on and then we go into a patient room and we touch everything. And then we pour the patient a cup of water and hand it to them with those gloves. So what we need to know, just like the sandwich, is who were those gloves there to protect? Now, you may think those gloves are there to protect you. You might think that. And they are to a certain extent, but not as much as you think. Those gloves are really there to protect the patient. Do you remember talking on Monday about how patients bring all of their pathogens with them and they have to prove that they're sick enough to get a bed? So these are really big, bad pathogens, right? So all of our patients are in an environment with a whole lot of big, bad pathogens, and their immune systems are currently occupied. So if we bring additional pathogens to them, it could likely kill them. Does that make sense? So those gloves need to be there to protect our patients from pathogens in the environment. They're there to help us too, but not as much as you think. And I'll explain why in just a minute. So everybody good with this? Okay, let's talk about the chain of infection and how this impacts what we do. Okay, so we have a lot of places we can work in healthcare. You can work in hospitals, rehabilitation centers, nursing homes, hospice, outpatient surgery centers, mental health centers, doctors' offices, and walk-in clinics, and a million others that I didn't have room to put on here, right? These are the big ones, but a million others. So we know that healthcare happens in a lot of different places. And we know that all of those places use gloves. So what we need to figure out is, why are we using the gloves and what do they really do? If we just walk into a place and put gloves on without ever thinking about it, we're actually going to put everybody at risk, at bigger risk. Because just like that sandwich maker, when you start wearing gloves routinely, you stop paying attention to what you touch with those gloves. Remember, our person at risk is the patient. So we've got to be a little smarter about this. So in order to understand the chain of infection, let's go to page 123. So this is a bigger version of the graph on page 123. And we're going to talk about each step in the chain of infection and how it's going to relate to gloves and what we're using gloves for. So our steps in the chain of infection are pathogen, reservoir, or host. Host is easier to say. Portal of exit, mode of transmission, portal of entry, and a susceptible host. So let's go through each one of these to figure out what they mean. So first of all, no pathogen, no problem. That's kind of if there's no pathogen to worry about, we can't spread it, right? So the chain of infection only starts when there's a pathogen. So if you have hepatitis C, you have a pathogen. You can then spread it to somebody else. If you have no hepatitis C, you are in no danger of spreading hepatitis C anywhere else because you don't even have it. Make sense? So first, we have to have a pathogen. But the thing about pathogens are they're pretty picky. They're actually little divas. They really are. Pathogens they're not homeless. They don't do homeless. Okay, they don't do homeless. Pathogens need a place to live. And the place they live has to be pretty comfortable for them, actually. They need a nice, warm place to live. They don't do homeless. Pathogens don't live outside the body for very long at all. So, and that's kind of important to understand, right? They have to have a place to live. So human bodies are great places to live. That table is not. That chair, not. It's too cold. Do you remember on Monday we talked about warm, dark, moist? Remember that? Warm, dark, moist? Well, that's where pathogens need to live. This table, not warm, not dark, dry as a bone. Pathogens aren't going to live there very long. Okay, good. So where does a pathogen like to live? Well, in a house. We call that a reservoir. In a person or something living, we call it a host. Now, a reservoir doesn't have to be living. So the inside of that toilet bucket over there, it's warm. It's got urine in it. It's moist. Lid's down. It's dark. So pathogens might be lurking in there, but it's not living. So it's not a host. Good? Make sense? So reservoirs are places that pathogens live that are non-living. Hosts are places that pathogens live that are living. So a rat can be a host. A mosquito can be a host. Good? Questions? All right. As long as that pathogen is inside the host, it is happy. It's not trying to break out. It's kind of like you in your living room, sitting on your couch, watching Netflix. You're happy there. You're not trying to escape. Nothing is threatening you. You're happy. So pathogens inside a host are pretty happy. The only time that they leave is when they're forced out. So forcing a pathogen out is kind of what your body does. When your body notices that a pathogen has invaded and has set up home, your body says, whoa, hold up. You don't belong here. I need to get you out. So it starts being mean, inhospitable. Have you ever had a visitor that overstayed their welcome? And you had to kind of like be forceful to get them out. You start slamming cabinet doors, sighing really loudly, doing all the things to not let them know they're no longer welcome. That's what your body does. That's why you run fever. Fever is your body's way of turning up the thermostat to make this guy uncomfortable so he leaves. That's what a fever is when you get sick. Sneezing. That's your body's way of trying to force that pathogen out through a doorway. So you start sneezing to get rid of the pathogen. Same thing with coughing. We're coughing the pathogen out. Good? Makes sense? Okay. So pathogens, as long as they're in a host, they're happy there. They don't want to leave. They kind of have to be forced out. But they can't leave through the skin. That doesn't happen. Like they don't have little drills with them. They can't like drill through, right? They have to go through an open doorway. So think about all the open doorways that a pathogen can leave through. Your nose, your mouth, other holes in your body. We'll get to that in a minute. But they have to leave through an open doorway, usually by force. So what are open doorways? Well, in the body, a doorway is any wet body opening. So eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, and incisions. Those are all what we call wet body openings or portals of exit, places that pathogens can escape from or be forced out. This is why when you have a wound, you have wound drainage. Your body's trying to force that pathogen out. Pretty cool, right? Okay. So a wet body opening is eyes, nose, mouth, genitals, anus, wounds, rashes, sores, and incisions. The problem is that pathogens can't get around on their own. They don't have feet. They can't walk. They don't have wings. They can't fly. They have to rely on some other external method of transportation. So if you sneeze, those pathogens are going to be forced out on mucus droplets that are going to spread. When you cough, those pathogens are forced out on mucus droplets and saliva that spread. But they don't spread far because these droplets are pretty heavy. They fall pretty quick. So like within 6 feet of me is about all that they'll be able to spread. They're not any danger to you way over there because they don't fly. Good. And remember, they don't live on inanimate objects very long. They have to have a way of getting around because they don't have their own way of getting around. So that means that all pathogens have to travel in fluid or they hitch a ride on particles suspended in the air. The best way to remember this is that pathogens have to float or flow to get around. They have to float or flow to get around. So that means that they're not just like hanging out midair in most cases. How they get around is called their mode of transmission. Getting out of a host isn't really enough. They actually have to be able to travel to you. Now, this is where we go wrong. We can't help the fact the patient has a pathogen. I can't fix that. I can't help the fact that the patient has doorways that this pathogen is going to be forced out of. Sneezing, coughing, I can't help that. This right here is where the first step where I can actually do something, right? I can help prevent this pathogen from making its way around. And this is where gloves come in. Okay, we're going to come back to this in a little bit. Remember that pathogens have to float or flow. But just because a pathogen is able to get around doesn't necessarily mean that it's going to get in somebody else, because pathogens, again, they don't have a drill in their back pocket. They have to go in through one of those same open doorways. So they have to enter through the nose. You breathe in through the mouth. You eat. Or bring your hands up near your mouth. Through your genitals. Unprotected sex, through your anal area. I don't want to go there. through wounds, rashes, sores, or incisions. So those same doorways that let the pathogens out of the patient are going to let those same pathogens in to your body. So the rule of thumb here is don't let stuff from other people's holes into any of yours. It's that simple. Don't let stuff from other people's holes into any of yours. If you follow that rule, you're safe because they can't get in. They don't drill in through the skin. Good? So cover your holes. Don't let stuff from other people's holes into any of yours. If that pathogen cannot find an open door to enter, everything stops. They can't get in you. And remember, pathogens don't do well homeless. They're little divas. They don't do well homeless, which means they will eventually die. That's what we want. If they do find an open doorway, though, and they are able to invade, all hope is not lost yet. You're not infected yet. You're invaded, but you're not infected. And it's shocking how many times your body is invaded every day by pathogens. The good news for us is that even though you're invaded, you have an immune system. And your immune system is a pretty miraculous thing. So what happens when your immune system gets activated is that it recognizes, okay, there's an intruder. It goes to its little filing cabinet and it says, okay, have we seen this intruder before? Have we seen this intruder before? And if we have, seen that intruder before, we have kept a little index card in our filing cabinet that tells us exactly how to kill that intruder. If we don't have an index card that tells us how to kill that intruder, things get a little harder, okay? So this is what we call the incubation period, where we're invaded, but not necessarily infected. Make sense? Good. So let me explain how this works. Because not only do we have an immune system, our pathogens have the same system. So we have to understand how this works because it affects us and them. So let's say that you three are, good luck. Okay, so let's say that some intruder barges through that door. Barges through the door. And there's a whole bunch of other intruders out there, but they send one in first. And you guys are closest. So you have to keep the rest of us safe because you're closer. So you have an intruder come in, you pick up that water bottle and you start banging him on the head. Now you scare him off. He goes back out there, but you didn't kill him. He goes back out there and he tells everybody, hey, when you go in that door, they're going to bang you on the head with a water bottle, so wear a helmet. So the next intruder that comes in, but what are they wearing? A helmet, because they were warned. So you know that water bottle's not going to help. You pick up that highlighter and you start stabbing them in the eyes. You didn't kill them. You scared them off. So they run outside and they say, okay, well, water bottle, wear the helmet. But when you get in, they're going to start stabbing you in the eyes with a highlighter. So grab some glasses. So the third one that comes in has got a helmet and glasses. And you look at him and go, oh, I don't like the looks of you. So you grab that fire extinguisher, you bang him on top of the head, and congratulations, we've killed him. Now, he can't go out there and tell anybody else what's happening in here. Make sense? Good. Now, if you had killed the first one, we know water bottle works, right? We don't have to go to the other steps, and he doesn't have a chance to go out there and tell the rest of the world what's coming his way. So the name of the game here is to kill the pathogen before they have a chance to communicate. Does that make sense? Okay. So that is an important part of infection control, right? We want to kill those pathogens, but it's a process. We got to try a lot of things. Now, We know, okay, if we're the pathogens, we know because we kept an index card. They tried the water bottle, they tried the highlighter, fire extinguisher worked, right? So they know that. But we do too. So now the next time a pathogen comes in, we're going to skip the water bottle. We're going to skip the highlighter. What are we going straight for? The fire extinguisher. Absolutely. We're going to get rid of that pathogen right away because now we know what worked. Make sense? Good. That's what's on that index card. So if a pathogen invades and we've seen it before, we know how to kill it, and we kill it before it ever has a chance to set up home. That is called immunity. Now, you have, just by being on planet Earth and being sick many times in your life, you have a whole filing cabinet full of index cards that tell your immune system how to kill whatever pathogen you happen to encounter. It's only when we encounter new ones that we have to go through the whole process, and that takes time. And sometimes the pathogens win and they make us sick. Sometimes we get lucky and we kill the pathogen first. Good. So infected is when we have a pathogen that took hold and we weren't able to kill it right away. Now we probably need a little help. Maybe some antibiotics or some antivirals or something like that. Or lots of vitamin C in the Hallmark Channel. Either way. So does this make sense? Do you guys understand the chain of infection here? So we have a pathogen. They have to have a nice warm place to live. Once they're in that nice warm place to live, if they get kicked out through an open doorway, eyes, nose, mouth, genitals, anus, wounds, rash, sore, or incision, and they're out in the world, they have to have a way of getting from one place to another. They have to float or flow. Now, if you pick them up and you bring them to any of your open doorways and they're able to get in, now they're in a nice warm place. And we have to hope that our immune system has seen them before and we're able to kill them quickly. Now, if we can't kill them quickly, now we become a host. Okay. The good news is that we can actually give our white blood cells an instruction manual. It's pretty cool, actually. Instead of our white blood cells having to go through the water bottle, the highlighter, and finally getting to the fire extinguisher, we can actually give an instruction manual to our white blood cells that says, hey, if you see this guy right here, this dude, this is what he looks like. If you see this guy, this is how to kill him. Right? Wouldn't that be helpful? That way we don't have to spend all that time going through all these things that don't work. This is a vaccine. That is all your vaccine does. That is it. All the vaccine does is it provides a picture to your white blood cells. This guy right here, this is what he looks like. Wanted poster. And this is how we kill him. So if that pathogen invades, your immune system has a head start. So we can get immunity by fighting him off ourselves, going through the process, water bottle, highlighter, fire extinguisher. Or we can get acquired immunity by having a vaccine that gives us all that same information. Okay? Think of a vaccine like a boot camp. Not really war itself, but it'll give you the tools you need should you find yourself in a war. So having a healthy immune system will allow your trained white blood cells to detect an invader and kill it before it has a chance to replicate. Now, let me explain to you something about viruses. Now, viruses and bacteria are two totally different things. Totally different things. That's like saying a car is an airplane. They're not. They both may get you somewhere, but a car is not an airplane. They're two totally different things, right? So a virus and a bacteria are two totally different things. So a bacteria is a living entity that invades and causes havoc. Okay. Basically, it's a chaos. That's what it does. Virus operates completely different. A virus invades your cell. And it's always looking for a specific type of cell. Every virus has a different flavor that they like. Some viruses like liver cells. That's hepatitis. Some viruses like spleen cells. That's HIV. Some viruses like brain cells. Meningitis. Some viruses like skin cells. So every virus has a different type of cell that they prefer. Think of it like a flavor. Okay? And they're programmed to look for those cells. And when they find that cell and they get in, virus gets into that cell, what it does is really diabolical. I mean, they're like really like evil henchmen. They're horrible. Viruses are horrible. When they invade that cell, right? We have DNA in our cells. You guys know about DNA, right? Well, what it does is it takes the DNA, it rips it in half, and it plugs itself into the half that remains. So it's changing your DNA. And then once it does that in your cell, it tells the cell, yeah, whatever you were doing before, that's not your priority now. We don't do that. You now make more copies of me. And that's what a virus does. It turns your cells into little reproduction factories for the virus. And then those viruses attack more cells, turn them off, and create more little factories for themselves. So now your lung cells are not doing what lung cells are supposed to do. They're too busy trying to create more viruses. So do you see how viruses can be really, really dangerous? Okay, because it keeps your cell from doing what your cell is supposed to do, and instead it creates a whole lot more of itself. And that's going to affect more cells. So it's really important that we try to get on top of viruses as quick as we can. Okay. So good? Make sense? Okay. All right. So remember that viruses or pathogens in general don't survive very long on surfaces outside of the body. They have to have a way in. Skin-to-skin contact is not enough. Viruses, pathogens, bacteria, all the bad guys, they don't drill. So I can come over here. You can have all the horrible diseases. I can come over here and hold your hand and give you comfort. I'm okay. Because those viruses aren't going to penetrate his skin to get out and penetrate my skin to get in. But once I've touched it, once I've touched that pathogen, chances are my nose is going to itch at some point. So if I come up here and do this, now that pathogen has a doorway in. Do you guys see that? So anytime you touch a patient, what do you think the next thing you should do is? Wash your hands. If you're going to touch a patient, do you want to bring pathogens to them?
No.
So what do we need to do before?
Wash your hands.
You guys see that gloves were not mentioned anywhere in there? Good. Hand washing is the single most important action we can take to prevent the spread of infection. And that includes hand sanitizer, but remember that we don't dispose of them, we just kill them. Okay, so remember that those pathogens have to get into your doorways. So here's our entire chain of infection. We have to have a pathogen. That pathogen has to have a place to live and find a doorway out that is already existing, right? They don't drill. They have to travel either on air or fluids to a new person, and then they have to have a new way in. Remember, they don't drill, so a new doorway in. That person has to have an immune system that's never seen that pathogen before to be susceptible, and now the pathogen can procreate and they are in a new host, and that's how the cycle can continue. Good? you may have a question on the state exam about the chain of infection. So this is important for you to know. Okay? It's important for you to know that pathogens don't escape through the skin. They have to escape through a doorway and travel through some other means. So, keep stuff from other people's holes out of yours. Cover your holes. So, if I have, I don't know if I told you guys this, I have a little dog. She's adorable. I love her. She is my heart. Her name is Annie. She's a little Labradoodle. She weighs 10 pounds. She's tiny, tiny. And she is currently pregnant.
Oh, Lord.
And she is going to have puppies in the next 10 to 14 days. Now, I'm going to play with those puppies like there's no tomorrow because Annie is my heart. And I am having puppies. Right? So these are going to be, you will see me at the end of this class with scratches all over my hands because I'm going to have two little adorable puppies to play with. And they're going to scratch me. Now, if I have scratches, those are openings, doorways.
It's a pathogen.
So if I am going to perform skills and I have additional doorways on my hands, what do you think I could do to prevent pathogens from getting into those doorways?
Wear gloves.
I could wear gloves.
Wash your hands.
What's that?
Cover.
Cover them. I could put a bandage, a Band-Aid on them. Yeah. I could wash my hands more frequently. So it's up to us when we know that we have additional holes to make sure that we're covering them. Good? Make sense? Okay. All right, so let's think about who actually needs this extra layer of protection, us or the patient. Well, you're pretty healthy, right? You're not the one in the bed. You're working. You get enough rest. You get your 20 minutes of exercise every day. You eat right. We do that, right? We could all stand to improve that a little bit. If we are going to be working in a pathogen-rich environment, we have to think about our immune system. So if you're not getting enough rest, if you're not eating right, if you're not getting exercise, you probably want to start if we're going to be working around patients. We want to boost our immune system to be the best immune system it can be so that it has the best opportunity to keep us safe. But at the end of the day, even the immune system you have right now is better than the one the patient's got because right now their immune system's fighting something off. Make sense? So you are much more resilient than your patient is. Remember, their immune system is currently busy trying to heal whatever's trying to kill them. And make no mistake, this is a battle to the death. Somebody is dying, whether it's the pathogen or your patient. Somebody is dying. This is a battle to the death. So, if it's that serious, do we really want to bring another pathogen to the party? Especially the biggest, baddest pathogens in town? So we've got to be careful when we're working with patients to understand that they're the ones at risk here. And that is why we want to wear gloves, to provide an extra layer of protection. Because if you remember, we talked about on Monday, we talked about the things that CNAs do. Do you guys remember the ADLs, right? Bathing, we're around their holes. Dressing, we're around their holes. Grooming, mouth care, we're around their holes. Toileting, we're definitely around their holes, right? So most of what we do as CNAs, are going to put us in very close proximity to your patient's doorways. And we have to be aware of that. We're not putting our hands up here when we're doing mouth care. We're putting our hands there when we're doing mouth care, next to their holes, not ours. So who's really at risk here? Patient. Remember, pathogens can't get through the skin. So when we're helping our patients with ADLs, we have to understand that just by doing ADLs on this patient, we are potentially bringing pathogens to their doorways. So we've got to be a little bit smarter about this. So bathing, feeding, mouth care, denture care, peri-care, catheter care, toileting, all of those things are going to put you in proximity to the patient's holes. We want to make sure that we're providing an extra layer of protection for the patient during those skills. Yeah, the doorways can let the pathogens out of the patient, sure, but it's also going to let pathogens in, and they're the ones at risk. Patient may not have an ability to fight that pathogen. So the gloves are going to provide an extra layer of protection for the patient. Yes, us too, but that's secondary. That's secondary. So what can we do about the potential pathogens coming out of the patient? Well, remember, they have to use doorways and fluids. So if we're going to touch body fluids, personal skin, or non-intact skin, so basically, if we're going to touch any wet body openings, we're going to use a set of gloves as an extra layer of protection. The problem is that you can't tell by looking at somebody if they have a pathogen. Like, I can't look at you and say, yep, you've got HIV. Yep, you've got hepatitis C. Yep, you've got COVID. Yep, you've got... I can't do that. There's nothing on your head that says, I have a pathogen. Man, it would be so much easier if there were. So much easier. But there's not. So you can't tell by looking at somebody whether they have a pathogen. So we use something called standard precautions. Standard precautions means I don't care who you are. If I'm going to touch any of your body fluids, personal skin, or non-intact skin, I'm wearing gloves because I need an extra layer of protection for both you and me. Make sense? This is standard precaution. So we don't use gloves just with the people we think are sick. We use gloves if we're going to touch body fluids, personal skin, or non-intact skin on anybody. And let me tell you how serious I am about this. Many years ago, my son, who was, 18, 19, 20, somewhere in there, it was a while ago, somewhere in there, he went to work with my husband, and they were doing demo work, okay, demolishing stuff. And he dropped a shelving unit on his leg. And it kind of sliced through the skin of his shin and his ankle. Pretty bad. My husband calls me up on the phone and says, what do I do? I said, go to CVS or Walgreens, one of the drugstores, and get these things, clean the wound, put a dressing on it, bring him home to me. So he brought him home to me, and it was like a 2 or 3 hour drive. I mean, it was a long time. Brought him home to me. And first thing I did is put gloves on and check the bandage off. And my son's like, Mom, why are you putting gloves on? And I said, well, you are my son and I love you dearly, but you have been out of my sight for more than 20 minutes in your life. And I don't know what you put where. So I have no way of knowing what is inside of you. So if I am going to touch body fluids, personal skin, or non-intact skin, I'm going to wear gloves, even with my son. That's how serious this is, because you don't know by looking at somebody what they have. Okay? So don't make the mistake of, oh, you look healthy, you're fine. Doesn't work like that. Okay? That is called standard precautions. So when we're working with all patients, we have to assume that they are a host. And remember, pathogens travel primarily in fluids. So if we're going to touch personal skin, non-intact skin, or body fluids, we need gloves. This is called universal precautions or standard precautions. You will have a test question on standard precautions or universal precautions. So you need to know what that is. It means we treat everyone as if they have a pathogen, whether we know it or not. So if we're going to touch body fluids, personal skin, or non-intact skin, we need an extra layer of protection. Okay. You took the written test, didn't you? And you passed it, right? Okay, did they have a question on on standard precautions? Yeah. Understand that the test changes like every 6 weeks, the test questions, but they're all pretty standardized, so we know what's going to be on the test. We may not know the exact question, but we know the topics.
Not all of it, but some of it's common sense.
Yeah, a lot of it is. Yeah. All right, so when we're evaluating whether we need gloves, think of doorways. Am I going to touch something that can let a pathogen out or let a pathogen in? If the answer is yes, you need gloves. If I'm going to touch this plain old skin that's intact, you're good. Wash your hands before, wash your hands after. But if we are going to wear gloves, we have to think about how to keep our patients safe. And the first thing your gloves should touch is the patient. Not the supplies, not the privacy curtain, not the bed controller, not a million other things. The first thing those gloves should touch is the patient. That keeps your gloves clean for the patient. We don't want to bring pathogens to the patient. So our nurse that goes into a room, closes privacy curtain, does a skill, empties the urine out of the urine bag, disposes of it, and then pours the patient a cup of water and hands it to them. Gross. They have pathogens all over those gloves, and they have just handed that patient a handful of pathogens. So what's the first thing our gloves should touch? The patient, always. Now this is going to mess you guys up when we get into skills, because I've seen it a million times. Students, they've heard me say this. We've had this conversation. They've seen all the things on the screen. And yet when it comes time to do skills, students will put their gloves on and then go get their supplies. Don't do that. What's first thing your gloves should touch?
The patient.
The patient, absolutely. So I will remind you as you're in here practicing, the first thing your gloves should touch is the patient. All right. Once you've touched the patient, now your gloves are unclean because you've touched the patient. So we've got to be careful about what we're touching in the environment then. So we don't want dirty gloves to touch a lot of things like the curtain or the bed controller or whatever else. We want to be careful about cross-contamination in our environment. So we want to remove those gloves as quickly as we can after patient care has finished. And then we have to know how to remove our gloves correctly. I'm going to get into that in just a second. But first, I want to explain to you what gloves are not. A lot of people think gloves are like this magic suit of armor that protects you from anything your patient might have. That's actually furthest from the truth. They are not as much protection as you think, and I'm going to prove it to you. So you guys have all seen, birthday balloons, right? You go to the store, you have them filled up with helium, they bop up against the ceiling for a while. What happens to that balloon over time? It deflates. It gets smaller, right? So how does that happen? Well, these balloons are latex, same thing as your gloves. When you inflate a balloon and the balloon stretches, okay, the fabric of the balloon stretches as well. Now, the fabric of the balloon has little tiny itty bitty microscopic holes. Can't see them with your eyes, but they're microscopic holes. And over time, the helium that's inside that balloon is able to leak out through those holes. It takes time, but the helium is able to leak out. And that shows us that that latex has holes. Well, if helium can get through, pathogens can get through. There's holes. Make sense? They're not the magic suit of armor you think they are. So, on the surface of the glove, as we stretch that glove out, just like the balloon, those holes get a little bit bigger. And like the balloon that let helium out, these holes can allow pathogens in. Now, inside that glove, anybody ever wear gloves? Rubber gloves? What does it make your hands do? Sweat. So, do you remember we talked on Monday about warm, dark, moist? You guys remember that? All right, inside that glove is warm, body heat. Dark, it blocks out light, and moist because we're sweating. So any pathogens that get through, man, it is nirvana. The ideal breeding place for pathogens. And they are going to go to town. And they are going to multiply and proliferate. Anybody ever see, if you go to a big box store, when they had cashiers, now they make us all do it ourselves, but when they had cashiers, you'd see these little old lady cashiers with gloves on, scanning all the stuff, right? They don't want to touch your ketchup. They don't know where your ketchup has been. They don't know who's touched that ketchup. They don't want to touch your ketchup. So they wear gloves. They scan all this stuff, right? They don't want to touch your money. And then at the end of their 4-hour shift, they go to the break room to have lunch. And they take those gloves off and they think that they're safe because they didn't touch your ketchup or your money. And they eat their tuna salad sandwich with a side of E. coli, not realizing that they actually have more pathogens on their hands now than if they had actually touched your ketchup bottle and washed their hands because they knew that they touched something unclean. Gloves provide a false sense of security, and they actually set you up for a much bigger problem. You need to understand this, because if you wear gloves, don't take them off and think that your hands are clean. If you take gloves off, what do you think you need to do? Wash your hands. Now, we have a hard time getting healthcare workers to do this. Healthcare workers will take their gloves off and then move on to the next patient. For some reason, healthcare workers think that this doesn't apply to them. This is going to spread pathogens throughout the facility from patient to patient to patient. So what glove manufacturers did, they thought, okay, we got to get these healthcare workers to actually wash their hands when they take these gloves off. So they put powder in it. Anybody ever have powder in your gloves? It's irritating to the skin. It has kind of a weird odor to it, right? The whole reason that exists is to get you to wash your hands after you take the gloves off. That's why it exists. We're just trying to get you to the sink. Or at least the hand sanitizer dispenser. Take your pick. So remember that inside that glove is the ideal breeding environment for pathogens. We might start out with 1 or 2. We're going to end with 1 or 2 trillion. They're quick little boogers. Do you know that pathogens don't need little boy pathogens, little girl pathogens, have baby pathogens? Doesn't work that way. There's no gestation period like my puppies, right? I got puppies coming. 63 days it takes to hatch a puppy. 63 days. So I'm on puppy countdown now. Just beware. Puppy countdown. 63 days. So she's incubating. She's growing some puppies. We got 2 coming. They're adorable. I saw the x-ray yesterday. I'm on cloud 9. 2 puppies in there. 63 days. But it took a little boy pup or a little boy dog and a little girl dog to make a couple of baby dogs, right? Pathogens don't work like that. Pathogens need the right conditions, and then they zip themselves in half, and now we have two. Doesn't take 63 days. It takes like 6 seconds. Right conditions, zip themselves in half, and they create a clone. So when I say that we might start out with 1 or 2 bacteria or pathogens in that glove, and we're going to end up with 1 or 2 trillion, that's how it happens. Because it goes from 1 to 2 to 4 to 8 to 16, 32, 64, 128, 256, 512, and so on. You guys see how quickly that can escalate? So we want to get those gloves off as soon as possible. So if pathogens got through your glove and onto your hands and multiplied, then hand washing is going to become very, very important. So page 43 is going to teach us how to remove our gloves. Is anybody in here allergic to latex? Do I have anybody allergic to latex? Good. Okay. Makes life easier. Now these are going to be big. I know they're big. Actually, don't play. Put the gloves down for a minute. We are going to take a quick break because I just realized what time it is. Step away from the gloves. Okay, we're going to take a quick break.
That's too loud. It's just a matter of if you remember it. They'll show you at the very beginning.
Oh, okay. Sorry. Can you pass those over, please? All right. So go ahead and we'll take our break, come back at 5 after. And then after break, we're going to talk about how to remove our gloves correctly. So go ahead.
Not anymore. I did activities at like a nursing home for a long time. Where were you? I was the one about my house.
I've heard that. Is that in Brooksville?
You working in the Saturday.
No, working in the worker.
Okay. The new
Senior living, yeah.
Yeah, the new one?
Yes.
Yeah, I saw that.
We all really need an activity person.
I already have my friend there.
cream table. I'm like, real good.
They don't have a activity directory.
They do. He doesn't like activity.
Mm.
So we just have one, like AM with a memory care. We don't have activity. Like, oh, it's annoying because everyone was like, what should we do? No, just watch TV.
They don't give you stuff. Yeah.
They have puzzle, but they puzzles and toys, you know,
Yeah.
but they want someone to, hey, that, let's say, you can't do that because we are blaming everyone, you know. Activity is really important. Because when they get bored, they know they have to be busy.
Is it a lady or a guy, the director?
Lady,
Mm.
they're still hiring right now.
See, before I worked there, I've never, did that kind of job. I've never worked around. So, like, when I apply, I don't really have, like, that's the only experience I have.
Mhm.
So, like, that's probably why. But I was there for, I think, like 2 years.
Oh, really?
Mhm.
Wow.
But, well, the only reason I left is because of the COVID thing.
Mhm.
They fired me because I didn't get the shot.
Oh, really?
Mhm.
Really? I thought that's like our rights, like we don't want to.
It was just, like right when it started. So, yeah.
I see.
Or I'd still be there, because I wasn't gonna leave.
That's okay.
It's their loss. Yeah. So, well, I only live like 2 miles away, so like I could walk there if I needed to. So,
That's still.
you have to lift a lot. Yeah.
Huh?
I heard that.
We have like 3 person right now that do it. Like it's supposed to be nursing home, but I don't know. But our DON said that it should be because lifting is very important. My back is killing me. Why I did the scanning and see, hey, you have equipment, the steel, so I can transfer there
Yeah.
if I want to.
And I'm nervous about. I don't really like lifting.
Yeah. Right.
First of all, I'm weak as I'm like, okay, I can barely lift.
Right. But activities are nice.
Yeah, I like it.
That's what I actually like every day.
Well, but I went to school for medical administration, and then somehow, I did my internship there, and that's how I got. And somehow, I don't know how I got in activity, but I ended up there.
You know what? I'm only an activity person and this is RN. You know what? She's so tired. She's 40 years nurse. And she's so tired of more responsibility. I want this job clean. I just want this job to like activity. She's just enjoying it.
Yeah.
She's RN. It was like, it's so funny because our deal would always talk to her because she is very knowledgeable. And I said, please, this is my job now. Don't ask me.
Yeah.
Everybody is relaxing. Much better. than lifting it. Good. Right? But in CNA, for example, like we have a rehab also. We have lots of equipment that need to be there.
I can see that. So we have like right up. I can't remember what that time.
There's a lot of rehab.
I've been in there.
But in Ohio, the one I'm working on now, there's another senior living. We have ALF, we have memory, we have.
We have all three.
Yes. Well, if I could my CNA, I will transfer.
You see, we had memory care unit. It's not very big. And then they had the ALF. That's all they had there.
I had it on the ladder framework. When I was there, my phone was sleeping.
Menores monto, monto del aspect. No man, on the band. The lady looking for this beauty in the summer. You are seeing long? No. I just come over here 2 months ago.
The CPR on Saturday, is this at 9?
Saturday at 9.
Um,
Or the fourth week of class, Monday at 2.
yeah, I'm
Well, guys, I'm doing a science experiment here. The mad scientist.
Is that the cedar?
Yeah, I actually forgot to bring the red food color. We'll use yellow. That looks like cedar. Okay. That should be enough. Okay, go ahead and put your gloves on. Once you have your gloves on, I want you to come over to the plate and put both of your hands in the shaving cream and then rub them together.
yellow.
Yeah, it's better when they're red or blue. It's easier to see. It's hard to see the yellow on the gloves. But so fun. Okay, so your gloves should look something like this. Right? You have been gunked up. So now we got to figure out how to take these gloves off without letting any of this gunk touch us. So we can't go underneath. What happens if I go underneath? Yeah, absolutely. So I've got to figure out how to get these gloves off without touching the glove to my skin. Skin can touch skin, but skin cannot touch dirty gloves. So we're going to pinch up here. You're going to pinch up right here at the palm of your hand and turn this inside out as you take it off. Except for my watch. Turn it inside out. Wind it up in this hand so that you don't contaminate. Now, take your fingers and go underneath. Don't do this. If I do this, what happens? Yeah, so underneath and pull that off inside out. So you should have one inside out glove inside another inside out glove. And if you did it right, you won't have any shaving cream on your hands. If you didn't do it right, you need to practice. All right. You guys, and unfortunately, I got shaving cream on me because of my watch. You guys can throw those away and grab a paper towel to clean up if you need to. This is a great way, and this is something you can all do at home to practice. Grab some gloves. Just take shaving cream and a little bit of food coloring, any color. Mix it together, and you can practice taking your gloves off because it's going to show you right away if you contaminated yourself. This is important because on the state exam, when you go to take your gloves off, they're looking for contamination. They're looking for actions that would lead to contamination. Good? Make sense? Any questions on that? It's a fun little experiment, isn't it? All right. So, Dwayne says, I took this class back in 2012. Good times. Yeah, I've been teaching for a long time. Thanks for joining. Okay. So our steps are in picture form. We're going to, especially for those of you at home, we're going to pinch up at the palm of the hand, pull this glove off inside out, and then wind it up in the palm of this hand. That keeps it from waving around and contaminating other areas. You want to keep control of that contaminated glove. Then with our free hand, we're going to go underneath the cuff of the glove and pull that off inside out. So one glove is inside out, inside the other inside out glove. Good. Questions? Are these helpful for you, these slides, the pictures? Yes. Pictures really are worth 1,000 words, I think. You know, so, and I'm the one saying the words, so a lot of words. All right, so our glove rules are, we're going to use gloves if we're going to touch anything that's body fluids, personal skin, or non-intact skin. The first thing those gloves should touch is the patient. Once you've touched the patient, you have to pay attention to what your dirty gloves have touched in the environment. Don't cross-contaminate. And then we have to remove those soiled gloves completely. So this is one of the big four. Remember, the big four apply to every single skill we do. Skill rules, opening, glove rules, and closing. Those four principles are going to be present in every single skill that we learn to do. So you're going to see this again and again and again and again and again. So go back to page 52. This is where we started. Okay, Christine says, would we be working with sterile gloves at some point in the practice? That is a great question. The answer is for basic CNA training, no. CNAs at a fundamental level, entry level, which is what you guys are not taught sterile technique. In some settings, in some instances, you may be taught sterile technique depending on what your employer requires. But that is state specific. Most states have statutes that prevent CNAs from performing anything that requires sterile technique without a different certification. Like you may get certified as a central sterile technician, but that's not a CNA. Okay, so that's going to depend in a large part on your employer policies as well as state statutes. In Florida, you can be trained for sterile technique, but that's additional. That's not entry level. Sterile technique is way harder. Most nurses get it wrong. So it's way harder. Okay. As a CNA, basic CNA, we don't go there. So we now know skill rules. We follow we know the opening. Every opening starts with. We know when to wear gloves. We have to evaluate it for every skill. And we know the closing. Thank you very much, Ms. Jones. Is there anything else I can get for you? Are you comfortable? Do you want a magazine? Environment's clean and safe. Open the curtain. Here's your call light. Wash your hands. Okay. Now we need to learn the steps of pulse itself. So this skill is going to start with the care plan. We have to read the care plan. Then we're going to do our opening. Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to take your vital signs or measure, record your pulse or however you want to say it. Nobody cares. Then we're going to evaluate if we need gloves. Remember, it's not skill specific. It's going to be patient specific. And then we're going to do these steps, and then we're going to do the closing. So that's how we're going to put all of this together. So let's learn these steps. First, we have to figure out what is a pulse. Well, on the left side of your heart, left side of your chest, you have a heart. That heart squeezes. When that heart squeezes, it pushes out a wave of blood. That wave is going to push the one in front of it. That wave is going to push the one in front of it. And that wave pushes the one in front of it. This is how blood moves through your circulatory system. It's like the ocean. In the ocean, you have a wave and a valley, a wave and a valley, a wave and a valley, and a wave and a valley. That's what, if you were to cut your artery open, that's what you would see. Waves and valleys. Now, as the wave moves through, it actually causes a little bulge in the artery, right? The artery has to kind of expand around that wave. And then the artery kind of relaxes. So bulge, 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 bulge. Everybody good with that? So this is when a heart's contracting. This is when the heart is at rest in between contractions. Any questions on that? Do you guys understand that kind of at a fundamental level? Heart squeezes, pushes out a wave. The wave is going to make the artery expand a little bit. Hi. So go ahead and have a seat. So what we're going to do when we're taking a pulse is use two fingers. We never use our thumb. We do not use our thumb when we're taking a pulse. Two fingers. And we're going to push down on the artery. What we're trying to feel is these waves moving underneath our fingers. So if we push down on the artery, as a wave moves through, we're going to feel it as a thump. Next wave moves through, it's going to cause a thump. Thump, 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 thump. We're going to count the thumps. How long do we have to count? As long as care plan tells us to. Good? That's what a pulse is. We're going to count the waves as they move underneath our finger. If we press down on the artery, we're going to count the waves that we feel. Okay. Normal pulse rate is between 60 and 100. So there's a lot of counting going on here. Between 60 and 100. So where is the pulse located? Well, on your wrist. On your wrist, way up at the top. See where my thumb is right here? It's not down here. Way up at the top. There's a bone that runs right here along the top of your wrist. If you put your hand out like you're going to shake somebody's hand with your thumb pointing up, you'll feel that bone. Now, at the bendy part, not way down here, at the bendy part, if you put your fingers on that bone and stand them up like you're going to dive off a cliff with your thumb up, and then just roll them forward and put your thumb on the back, you should feel your thumbs. So, hand out, thumb up, feel the bone, 2 fingers standing on top of that bone, roll it forward, thumb on the back. If you do that, you should feel your thumbs. Now, it's helpful if you use your fingertips, not the flat part of your finger. Not as many nerves here. We want our fingertips. So don't just lay your fingertips on there. You're probably not going to feel it. We want our fingertips to be right there underneath that bone. So if you stand and roll, see where my fingertips are? Thumb on the back.
I'm not feeling anything.
So, okay. All right. So everybody see if you can find your pulse. If you're having trouble, I'm going to come around and help. So what finger should we not use to take a pulse? Thumb. So we're going to stand our fingers up and roll it forward. Thumb on the back. And we want our fingertips.
152. Yeah.
You
No,
can use
52.
probably because I have my watch for a long time now. I better delete it.
Is there a supposed
Yeah, probably. Tell my the watch.
You just press that.
Take it out.
I'll take your first part.
Now I'm more fun.
But it's here.
Okay, start right now. Where would it
In the
start?
watch.
Each one.
This is your bone right here.
Yes.
You stand up on the bone. We're going to roll it forward. Thumb on the back. Always thumb on the
Don't
back.
talk while you're trying to do it. You
Let me
never
see.
hear it.
Yeah, I know that, yes.
You never feel it. Not hear
It's
it.
very faint, but I feel it. It's there.
No, it would be back to the chest.
Yeah.
20 seconds, 20 seconds is
It's
washing
there.
your hands. It's 1 minute for your pulse.
You fix it now?
That's it. That's two numbers backwards.
Got it? Okay. Did you find it?
Yeah.
Find it? Did you find it?
Yes.
Did you find it?
1 minute.
Okay, did you find it? Did you find it? Did you find it? Everybody find one? Find somebody else's. Grab a partner.
I kind of had it abandoned.
Grab a partner. Nope, does not matter. If you're right-handed, use your right hand because it's more sensitive. If you're left-handed, use your left hand because it's more sensitive.
I think it's
So-
better with this.
You want me to do it?
I will feel you.
Yeah, are we supposed to relax the arm?
You can relax a little bit. You're a little too high. We want to be we want to be way down here at the bendy part and right where the thumb comes off. So right. That's where it hurts. Remember to put your thumb on the back. Put your thumb on the back. This is important. Thumb on the back. This is important. If you just set your fingers here, you might find the pulse. You might get lucky. The problem is that your fingers are going to relax. Nothing you can do about that. They just do. So if you just set your fingers there and your fingers relax, you will lose the pulse every time. That's what this is for. When you put your thumb on the back, it holds consistent pressure and you don't lose the count. Thumb on the back, super important. Little harder. Can't find it? Let me help.
I'm not alive.
Let me help.
Some people's it's really hard to find. It's right here, right there. It's a little harder. It was actually funny because in my
Okay.
in my clinicals, he goes, my pulse is really
Good,
hard.
Emily.
So you know, and I found it right off the bat. I'm like,
good.
God, you're looking after me.
Important. All right. So you can see this is where the radial pulse is located. It's right where the thumb comes off of the hand, right at the bendy part. Notice I'm not down here. I'm not down here. It's way up here. Now, there are other pulse points in the body. There's lots of pulse points in the body. We have radial at the wrist. We have brachial at the elbow, which we're going to talk about on Monday. We have carotid, which is up here. We have axillary, which is on the inside of the underarm. We have femoral, which is in the groin. You have popliteal at the back of the knee, and you have dorsal pedalis at the top of the foot. There's other pulse points as well. Those are the main ones. Do you remember on Monday, we said that CNAs do normal. This is normal. This is normal. If we need a femoral pulse, that is not normal. Who would have to do that?
Nurse.
If we need an axial pulse, that is not normal. Who would need to do that?
The nurse.
You can be trained to do those things. But starting out, CNAs do?
Normal.
Okay, wrist is normal. Carotid is not. This carotid pulse we use when we think somebody is dead. So we use it for CPR. Now, the problem is that if we try to use a carotid pulse for just a regular pulse rate, let me show you how this works. Okay, and I'm going to pick on you because you're right there. Okay. So if I'm going to take a carotid pulse on him, this is what it looks like. How comfortable do you think he is with my hand around his throat?
It could be very uncomfortable.
Yeah, we're strangers. He has no idea what I have in mind for him. What do you think anxiety is going to do to a heart rate? Raises it. So am I going to get an accurate reading
No.
if I'm using the carotid? We do not use the carotid pulse unless we think the patient is dead because I'm trying to get a reaction. Okay, so we use carotid for CPR, CC. Carotid for CPR, but not for CNA. Good? Questions on that? Okay. Oh, the elbow needs to be supported, by the way. If you have somebody just holding their arm out like this, that's going to put a lot of pressure on those muscles. It makes them contract to hold the arm up. Contracting muscles require more blood flow, which means the heart has to pump faster to get the blood to the arm. So what did we do to our pulse rate by having our patient hold their arm up? Yeah, we raised it. Is that accurate? No. So make sure that elbow is supported. All right, so how long do we count? As long as the care plan tells us to. Absolutely. This care plan, if you read it, it's right there on page 53. Is it 53? Yeah, 53. If you read the care plan at the top of the page, this is what it says. Patient will be lying in bed for this skill. Take the patient's radial pulse, measured at the wrist for
1 minute.
1 full minute, and record your readings. So counting is not enough. If you count something and it's up in your head, good for you. That's great. Doesn't help me a bit.
I don't mean you're going to remember it.
It doesn't mean you're going to remember it, but if you're counting something, it means the nurse needs that information to make a decision, to give a medication, to evaluate an outcome, to do something. The nurse needs that information to do something. So if you take a pulse and it's stuck up here and you didn't write it down, the nurse does not have access to your brain. They have no idea what that pulse rate is. Therefore, their job stops. So anything that you measure, you must record. For the exam, if you measure something and don't record it, you will fail. Now, did you fail because you forgot a step? Or did you fail because the patient is going to have a negative outcome?
You failed.
You failed because of the patient. Yep. The test isn't about your steps, ever. The test has nothing to do with, did you get this step? Did you forget this one? Has nothing to do with that. The test is all about what impact on the patient did that have. So if you measured something and you didn't write it down, that is going to impact the patient. And that's why you would fail. Does that make sense? Remember I told you I got 4 weeks to get your brains rewired. And that's the hardest part of my job. Remember that? The hardest part of my job is to rewire your brains to remember during the test, it's all about the patient. So this is only day 2. I still have 6 more to go. We'll get there. All right, so this care plan tells us 1 full minute. But that's not how we're going to do it in a clinical setting most of the time. 1 full minute's a long time. You guys are about to find out just how long a minute is. It is a very long time. So, if the care plan doesn't tell us to count for 1 full minute, there's a shortcut we can use. And that shortcut is we count for 15 seconds. Now, if you look at this clock, not everybody knows how to read these types of clocks, but if you look at this clock, there's 4 15-second segments in a minute, right? So this is 1 full minute. So that's 1 15 second, 2 15 seconds, 3 15 seconds, 4 15 seconds. So if I count for 15 seconds, I need to multiply it by 4 to get my full minute. Pulses are always recorded over a full minute. Whether we're counting for a full minute or we're counting for 15 seconds and multiplying that by 4, it's still a full minute. Make sense? That's what we're going to report over. So we either count for a full minute or we count for 15 seconds and multiply that by 4. Which method will we have to use with each patient?
Or the care plan.
There it is. Easy answer. Whatever the care plan tells us. Easy answer. So if you have a test question that asks, how long do you count the radial pulse for? And your answers are A, 1 full minute, 2, or B, 15 seconds multiplied by 4, C, 30 seconds and multiply by 2, or D, whatever the care plan says, what would your answer be?
Whatever the care plan says.
Whatever the care plan says. Yes, because all of those are correct. Counting for a full minute, counting for 15 seconds, multiplying that by 4, counting for 30 seconds, multiplying that by 2. You can do all of that to get a minute. Which one do we use? The one the care plan tells us to. Good? Questions? That messes people up on the state exam. So just heads up. Starting to see how important that care plan is?
It's your holy Bible in the work field.
What's that?
It's your Bible in the work field.
Oh, it's absolutely your Bible. Absolutely. All right. So here's our page 53. This is going to give us step-by-step instructions on how to perform this skill. Care plans at the top. Step-by-step instructions. This you can use at home to be able to practice. You just follow these steps exactly. So if you notice, 1, 2, 3, and 4 are the opening. You guys see that? Yeah. 12, 13, 14, 15, 16, and 17 are the closing. So what's in between is what we're going to learn. Okay. All right, so let's learn these. Okay, so we always want to support the arm. We talked about that. If we leave the arm out in midair, it's going to affect our pulse rate. That elbow needs to be supported. Doesn't matter whether it's a bed, table, back of a chair. I don't care what it's supported with. It needs to be supported. We're not going to use our thumb to take the pulse. We talked about that. Your thumb has an artery. It's the one finger you can't use to take a pulse. We want to use our fingertips, not the flat part. We talked about that too, because fingertips are more sensitive. Radial pulse is at the top of the thumb side of the wrist near the bone. We talked about where that pulse is, right? That bone right at the bendy part. We're always going to report over 1 minute, but we'll follow our care plan to tell us how long to count for. We talked about that too. Normal is 60 to 100. So all of this we've already gone over. We've already learned all this. Now let's get to here, number 7. When we're counting for the test, we're going to do our opening, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to get your vital signs, or I'm here to take your pulse, or however you want to say it. Nobody cares. Is that okay? Now, remember, for the test, your patients are always going to be pleasant, cooperative, and them. So they're going to say, yes, it's fine. You're going to close the curtain, wash your hands, and then approach the patient. Now, you get to decide which side of the bed you want to stand on. It's all you. You get to decide that. You're going to find that it's easier for you to be on one side of the bed or the other, depending on which, whether you're right-handed or left-handed. You get to pick. Whatever's left over, because remember, the patient has 2 arms. Let's say that I want to be on the right side, right hand. I'm going to be over here. Whatever's left over, the evaluators get. So the evaluator is going to be on the other side of the bed. They're also going to find the radial pulse at the wrist because they have to follow that care plan too. And then once you have found the pulse and they have found the pulse, and they're quick, they'll find it really quickly, then they need to know when you have started counting. So the only way for them to know that is for you to look at that clock, pick a starting point, and say out loud, start. You're going to count the thumb shoe feel under your fingers until that second hand goes all the way around to that same number. Once it gets all the way around to that same number, you are going to say stop. Good? Our care plan told us to count for how long?
1 minute.
1 full minute. So that means that second hand has to go all the way around. It's a long time. Boy, is that a long time.
Especially when you're testing.
It is a long time. Absolutely.
And you don't just have one person running it, you have 2.
Right. So in Florida, we have how many evaluators? 2. So what is the second evaluator doing? They're just standing around. It looks like it, but they're not. Do you remember with hand washing? You guys remember talking about hand washing? I told you when you go to the sink and you wet your hands and you put soap and you put them together, that second evaluator writes down the number that the second hand is on. And then when you move to your nails, they write down the number that the second hand is on. And that's how they determine if you did 20 seconds. You guys remember that? All right, they do that for pulse too. Evaluator number 1 is over there counting the pulse with you. Evaluator number 2 is writing down where you started and where you ended. And it better be a minute in between. And then after you count with evaluator number 1, they're going to switch. And you have to count with evaluator number 2 as well. Now, they don't expect you to remember count number 1 and try to count number 2. They don't expect you to you're stressed, you're testing, your brain cells have exited the building. They know this. It's okay. So they are going to let you write down that first reading without washing your hands, without doing the closing, they're just going to let you write it down. Then you'll count with number 2, and then you'll do your closing, wash your hands, document, wash your hands again. Good? Questions? Yes.
What is the more important when we wash the hand? Is it for the 20 seconds? Or
For hand washing,
uh-huh.
it's rubbing all surfaces for at least 20 seconds.
For other 20 seconds. wash your hand. No,
No,
it's
in
like
total.
like 3 seconds.
No.
My nail.
No, it's 20 seconds for everything before the nails. Nails don't count in that 20 seconds.
No.
So it's the backs of the wrists, the backs of the hands, in between the fingers, in between the thumb and index finger, the bottom of the hand by the pinky, the palm of the hand interlaced. All of those areas for at least
20 seconds.
20 seconds. And then you move on to your nails.
The last thing.
Last thing. But that's 20 seconds of friction before nails.
Okay.
Nails don't count in that.
Okay.
So they start counting right when our hands go together.
When you wet, put soap on, bring your hands together, that's when they start counting.
Always wash downwards, rinse
Right,
off downwards.
your hands need to be lower than your elbows. Low, and don't touch the inside of the sink or the faucet because those areas aren't clean. Okay. All right. So any questions on pulse? Okay, we're going to do this together. I'm going to break you up into groups. So just kind of bear with me for a minute, okay? I'm going to. Okay. So I need you to turn your chair around so you're facing them. Okay. And okay, and yeah, that'll work. Okay, so I'd like you to come over here. I want you to come sit here. And I want you to come sit here. Okay, so I've just divided you guys up into groups of 3. All right, the side of the table that has one person. So you, and you. You are the patient. Both of your hands are going to go onto the table, palm up like this. You're going to find the pulse on her left hand. You're going to find the pulse on her right hand. You're going to find the pulse on her left hand. You're going to find the pulse on her right hand. You're going to find the pulse on her left hand, right hand, left hand, right hand. Okay. So find the pulse on your patient. Find the pulse. When you have the pulse, I'm going to go around and make sure everybody has the pulse. Don't start counting yet. I'm going to do the timing for you. When you have the pulse and we start, I'm going to say start. I'll do the timing. All you're going to do is count the thumps that you feel under your finger from the time I say start until I say stop. Okay? And one of you is the CNA, the other is the evaluator. We'll see how close you get. All right, did you find the pulse? Did you find it? Find it? You having trouble? Okay. All right. You can use your right hand. It's fine.
Just use the truth.
Put your thumb back. Now, that is important. Oh, yeah. Did you find it? Okay, did you find it? Hold on 1 second, guys. Just keep your pulses. Keep your pulses. A little too hard. Not quite so hard. Loosen it a little bit. Got it? A little harder. Okay. Everybody good? When I say start, I want you to start counting the thumps you feel under your finger until I say stop. Here we go. Ready, set, start. Count quietly to yourself. What'd you get?
65.
73. 74. 75.
Okay. All right. Now, patient. If you were the patient, you are now the CNA, and the person, one of the other two people, is going to be the patient. So you're the patient. You're going to find her. Stay where you are. Just put your hands out. So you're the patient. Both of you are going to find the pulse. You're the patient. Both of you will find the pulse. So you're the patient. Both of you will find the pulse. When you find the pulse, when you have the pulse, please say yes.
Yes or no?
Yeah.
Because it separates that muscle.
It's really hard.
You can also feel it, you know.
Got it? Got it. Okay, everybody ready?
No, not yet.
Okay.
Not yet.
Okay.
A little too much in the middle of the wrist. It needs to be way up here. Relax. Make sure you put the thumb on the back. And the thumb is important. Thumb is important.
Heavy shift okay. That's that harder. And that got I'm probably skipping one word.
Why?
Okay. If you're not finding the pulse, press a little harder. All right, everybody ready? Everybody ready? Here we go. And start. And stop. Very good. What'd you get?
Next, 73. 72. 74.
I got better than you.
Okay.
27. You just gotta.
Okay. What'd you get?
You don't go with.
Okay. All right. Last person who has not been a patient is now the patient. Last person is now the patient. So there's two ways that you can hold a wrist. You can hold it like this, you know, with your fingers at the top of the wrist. You can also hold it like this, coming from the back. So there's two different ways that you can hold it. Just make sure your fingers are in the same place. Doesn't matter how you hold. When you have the pulse, say yes.
Yes.
Does anybody need help?
Gonna take a lot of
Got it? All right, everybody ready?
Yes.
Set.
Wait, hold on a minute.
Oh, okay.
Oh, no.
Press a little harder. Relax. If her hand is under stress, the muscles are contracting and covering. So we want those arms relaxed. Press the chamber hard. There's just very close to the concentrate. Feel a little, but press a little more then. You have to vary your pressure. Some are really close, some are really deep.
my thing.
Okay, ready? Here we go. Ready, set, start. Stop. Okay, how'd you do?
80.
I think that was more.
Whoa, wait, what?
64.
Okay. All right, go ahead and go back to your seats. Play musical chairs.
I think now, isn't it men's heart rate is lower than women's?
No, actually, no. Now, there can be a difference in heart rate. Remember, normal is 60 to 100, right? There can be, I'm going to sit for a few minutes. My knee is killing me. Sorry, guys. There can be a difference in heart rate based on the physical fitness of the individual. And let me explain why. If you have somebody who is a cardio athlete, so think of, I'm not talking about, you do a mile on the treadmill. That's not what I'm talking about here. I'm talking about the Michael Phelps that spend 10, 12 hours a day swimming laps, or the Lance Armstrongs that spend 10, 12 hours a day riding a bike. Cardio athletes, okay? Well, when we do cardio, anybody know what cardio means? Heart. So when we do cardio exercise, the muscle that we're working on is the heart. So if I were in the gym and I did bicep curls all day long, clearly I don't, but if I were and I did bicep curls all day long, I would have biceps to kill for, right? They'd be out to here. They'd be really super strong, very visible. You would be able to tell that I did bicep curls all day long, okay? The thing about the heart is that it's inside the body, so you can't really see it. When you do a lot of cardio, what you're strengthening is the heart. You're making the heart more powerful. Just like this would make my biceps more powerful, cardio activity makes the heart more powerful. So when somebody that does a lot of cardio, when their heart squeezes, it pushes out a huge wave of blood because it's powerful. So a cardio athlete, when that heart squeezes, the blood whoosh, huge wave. So because the waves are so big and so powerful, we don't need as many of them. So cardio athletes have a lower heart rate. Does that make sense? Now, then you have couch potatoes like me. My heart, when it squeezes, it goes, eh, 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 eh. So my heart isn't pumping as effectively. It's not as powerful. So I need a whole lot more pumps to get the same amount of blood around. So my heart rate is going to be higher. Lance Armstrong's heart rate is going to be lower. And his resting heart rate is about 35. Now, normal 60 to 100. We don't freak out about it because we know his vocation, what he does for a living, is cardio, strengthening his heart, which means it's going to pump more powerfully. It's not going to pump as often. So we don't get upset about that. Now, if you have somebody with my body type that has a heart rate of 35, we're running down the hallway because there's something really wrong with that. And my brain is not going to get enough oxygenated blood. Make sense? Now, on the other end of the spectrum, we have bodybuilders. Now, bodybuilders spend their time in the gym doing bicep curls and leg pushes and all kinds of stuff to make their visible muscles stronger. But do you know what they don't usually do? Cardio. Because cardio leans you out. It doesn't build muscle. So bodybuilders, they're trying to build muscle. So they're not doing cardio. So the one muscle they're not strengthening is their heart. But we're giving that heart way more real estate to oxygenate. So because we have more muscle mass, but our heart isn't any stronger, what do you think their heart rate's going to look like? We're going to need more pumps to get blood to all of this muscle because we didn't strengthen our heart. So bodybuilders will have a higher heart rate. Make sense? Pretty cool, huh? So it really doesn't have much to do with male, female. It has more to do with the physicality of the
So
individual.
like your daily activities.
Right, right. Now, all of us should be getting 20 minutes of cardio activity every day just to keep our heart like maintenance. That doesn't make it any better. That's just maintenance. Okay. How many of you guys drive a car? Okay. If you went with your car for 30 years and never once changed the oil,
It's gonna blow up.
what's going to happen to your car? Yeah, it's going to stop, right? Probably not going to last 30 years. You're going to do some serious damage. It's going to cost you tons of money to get that thing cleaned up because you didn't do daily normal maintenance, right? Well, that is what 20 minutes of cardio is for us. If we don't do our 20 minutes of cardio, our engine is going to blow. Like it's just going to give out. Yeah, so keep your car in good running shape. Get your 20 minutes cardio a day. Okay, good. Questions? Questions on pulse? Oh, Christine, what happens fades while taking the pulse? Okay, so if the pulse is fading when you're taking it, if you find it, it's really strong and then it kind of fades off and then you lose it, chances are you don't have your thumb on the back side. So remember I said thumb is important, right? Thumb is important. If you don't have your thumb on the back side of the wrist, you're going to lose it. It will fade out. But something else might be happening here too. So I want to talk about this really quick. This often happens with people that are very young, very old, or those that are very small. Okay? Young, old, and small. And what happens with these individuals is that the pulse rate will speed up and then it slows down. And then it speeds up and it slows down. And it speeds up and it slows down. So when you're taking the pulse, it's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. And you're like, what is going on? Are you alive? Is something wrong? So let me explain to you what's happening in here. So in our chest cavity, we have a sternum, which is a bone on the front, breastbone. We have a spine in the back, and we have ribs around the side. So it is literally a cage. Okay. Now inside that cage is your heart and your lungs. There's not much room in there. It is a cage. When your lungs inflate, when you breathe in, those lungs expand. Well, there's not much room in there. So as those lungs expand, they actually push in on the heart. And the heart reacts by going, whoa, and speeds up. When you exhale and there's more room, the heart is able to relax a little bit and the pulse rate comes down. Whoa! Okay. So this happens primarily with young people because their muscles haven't stretched. Not much room in there. Older people, because as we age, we get less bendy. Okay, so the muscles don't have as much give. And very thin people, because there's just not much room. So you'll see that sometimes when you're counting a pulse rate. It goes fast and then it goes slow. And then it goes fast and then it goes slow. But it's very regular in its irregularity. Okay. Good. Now that's different than a pulse that does this. There's no regular to that at all. It's just mass chaos. There's no rhyme or reason to it. When you get something like that, you need to stop and tell the nurse right away. Okay? Irregular heart rates always have to be reported immediately. Don't go to break and get some lunch and tell the nurse at the end of the shift, this is stop, and go let the nurse know right away. Because what that's telling us is that the top and the bottom of the heart are not working together. Think of a house where the two people are getting a divorce. Lots of yelling, cabinet slamming, silence. I mean, it's just a very miserable place, right? When we have an irregular heartbeat like that, a lot of times it's the top of the heart and the bottom of the heart that are in the middle of a divorce. And nothing is going right. Well, the kids always suffer. In this case, it's the heart rate that's going to suffer. That means your brain isn't getting good oxygen. Okay. Good.
So while testing, like what's like would you feel of like taking a pulse? Like, is there a number range? Like, say I say 65 and she says like 78.
Okay. So normal is 60 to 100. So as long as you're in that range, you're probably pretty safe as far as I think I did it right. Okay. 60 to 100. I think I'm okay. But you can be off by 4 beats in either direction and still be considered accurate for the test. So let's say the evaluator, or let's say you got 76. Okay, that's the number you counted. If the evaluator got 72, 73, 74, 75, 76, 77, 78, 79, or 80, you're still accurate.
So if we lose the pulse or need to restart?
Oh, you can restart as many times as you need to.
You can correct as many times.
Yep, and you can
Just gotta let
correct.
them know.
But I'm going to tell you a secret. Don't tell anybody. This doesn't go beyond our room. Okay. If for the test you do everything right, you do your opening, you follow the care plan, You count the radial pulse at the wrist for 1 full minute. You do your closing and you write the number down and you wash your hands like you're supposed to. You did the whole skill right, but the number is completely wrong. You will still pass. And the reason for that is that this is entry-level skills. That means that you're not a master of anything. Nothing. You know enough not to kill the patients when you're out there working. That's what the test is about. Are you going to kill your patients? And as long as you know the right technique, your accuracy will improve. Because with practice, you'll always get better. So your accuracy will improve. But if you're doing it wrong, no amount of practice is going to help you because you're always doing it wrong, right? So the test is grading your technique, not your accuracy. Does that make sense? But that's our little secret. We're going to keep that in this room. Okay? It's all about technique. But you can be off by 4 beats in either direction and still be okay. We know that once you get out there, you're going to get tons of practice with this. Tons and tons of practice. And you're going to be the best pulse takers in the country at some point. But that's probably not today.
When we finish each skill, we have to finish everything and wash again and wash your hand and start it over with the next one.
No, you are going to count. Okay, so you're evaluator 1. So you and I are going to count. They're going to let me write that number down. And then evaluator number 2, we're going to count. Then I'm going to do my closing. Thank you very much, Miss Jones. Is there anything else I can get for you? Would you like a magazine? Are you comfortable? Environment's clean and safe. Bed's in the low position. Here's your call light. Open the curtain. Wash my hands. A lot of steps. Write it down. Wash my hands again. So the first count, they're going to let you write that down without going through all those steps. Because out there, you're not counting with 2 people. You know, out there, you're only counting with yourself. Questions?
Sorry.
Go ahead.
So while you're testing, do you have to say, okay, then I'll wash my hands? Like, do you have to?
You don't have to. No, they're just going to let you write it down. Now, if you want to do it by the book, you can. You can do your you can count with evaluator number 1, do your whole closing, wash your hands, write it down, wash your hands again, do your opening, count with evaluator number 2, that you can do that. But let me tell you a little secret about the evaluators. These evaluators are RNs, and they've got a ton of experience and knowledge. And they're no longer working in clinical settings. They're kind of winding down their career. And they want to not be there. They want to be at home, floating in their pools, drinking their Mai Tais. That's where they want to be. But here they are, because they can't quite retire yet. So you and everything you do are what's standing between them and their pool and their Mai Tai at home. So the longer you take to do these skills, the more irritated they're going to get, because where do they want to be? At home in their pools, drinking their Mai Tais. So that's why we're allowed to take some shortcuts so that those evaluators can get home, because they don't want to be there. Now, I want to explain this really quickly to you. We talked on Monday about hand washing, right? I showed you how to do hand washing. Well, at the beginning and the end of your first skill, you are physically going to go over and really wash your hands. You're really going to turn the water on. You're really going to get them wet. You're really going to get soap. You're really going to rub them together. You're really going to clean your nails. You're really going to rinse them. You're really going to dry them. And you're really going to turn the faucet off with a paper towel. You're going to do all that at the beginning and the end of the first skill. After that first skill, Those evaluators are going to tell you you can simulate hand washing after this. So the next 2 skills, just simulate. Just simulate. Now, simulate means say. So all you have to do is say, I would wash my hands here. It's a whole lot quicker than you going to the sink and really turning the water on and really wetting your hands and really getting soap and all those other steps, right? Again, where the evaluators want to be? At home, in their pool, drinking their Mai Tais. That's where they want to be. So they are going to tell you to simulate after the first skill, after the hand washing at the beginning and the end of the first skill. Do not simulate until they tell you to, though. Because if you mess something up, they might give you another chance. And they may grade a different hand washing. So don't simulate until they tell you to. But it's all about saving them some time so that they can get home. It's where you want to be too, isn't it? You want that test over with as quick as possible. So take the gifts that they give you. Okay, good.
At least you get the results right then.
You do. Not all states do.
Really?
There's a lot of states, most states actually, that you have to go home and wait for results 2 or 3 days.
I remember taking my equivalent, and it could take up to 3 days to get those results, or you could get them right then.
Yeah. So in Florida, we're very, very lucky that we get our test results for the CNA test that day as we leave the facility. So we'll know right away whether we passed or not. Okay. You're going to do fine. You're going to do fine.
And then you get some tips.
Yep. Yep. So we have somebody that's joined us today who called me yesterday, and he unfortunately was unsuccessful on his state exam for the second time. So he's only got one more time to take it. And somebody told him, you need to get a hold of Miss Patty. So he called me yesterday and he asked me, what do I do? So I told him, make sure that you tune in to my live, and we'll walk you through the steps that you need to be successful on the state exam. Okay. Good. You guys are going to be fine. You don't have to have faith in you right now. You don't. You need to have faith in me.
Oh.
And I have over 120,000 subscribers on my YouTube channel that have put their faith in me and that have been successful. And guys, less than 10% of all people that watch my videos subscribe. We literally are responsible for millions of successful CNA students. You don't have to have faith in you. You need to have faith in me. I know what I'm doing. You will be successful. As long as you stay reasonably awake. Okay? You will be successful. Any questions on Pulse? No? Oh, that knee. Okay, I told you one day I'm going to be the body in the bed. All right, page 102. We are now going to learn another skill. This is dressing a resident with a weak arm. This is not a hard skill. But there's a couple things that we need to point out. So the first thing that I need to point out, these are the principles that are going to govern how we do this skill. Of course, we're always going to follow the care plan. We're going to do our opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to get you dressed. Is that okay? Close curtain, wash hands. We're going to evaluate if we need gloves. We'll get there in a minute. And then we've got these three: barrier rules, privacy blanket, and linen rules. We have skill specific, and then we have the closing. So if you look at this compared to Pulse, this is a lot more complex, a lot more principles. So we're going to learn the principles and how they govern this skill to learn how to do the skill. At the bottom, of course, I've got a video for this. At the bottom, you're going to see somebody with your level of experience should be able to complete this within 14 minutes or less. Guys, you're getting somebody dressed. Doesn't take, now, me in my closet might take 14 minutes picking out an outfit, but the actual dressing does not take 14 minutes. This is going to be done on a mannequin. We're going to treat that mannequin as if she's a real person. We're going to talk to her. We're going to ask her questions, and she's actually going to be responding to us, but it's the evaluator that is responding. Okay. That mannequin's going to be in bed, and this skill does not require charting. So let's go through the principles. So we already know skill rules, the opening, glove rules, and closing. We know our big four. Now we have to learn these three. So we're going to start out with barrier rules. This is pretty easy. Barriers are used in a lot of our skills, but not all. If you notice, you can see the ones that are grayed out. That's not used in that skill. So barrier rules are used in a lot of different skills that we're going to learn how to do. This one included. I have a video on this you can watch, but we're going to go through it step by step. All the notes are on page 85. Again, I take notes for you. You starting to see how easy this class is? It has evolved over 15 years. Actually, 17. My mother took my first class. Did I tell you guys that? Oh, I was scared to death. I was a nurse. I am a nurse. I was not a teacher. I taught CPR. That's easy. But this was something totally different. And I was nervous. Super nervous. I'm going to stand in front of people? Well, I only had 5 in my first class. It wasn't a lot of people, but I'm going to stand in front of people? I'm not real sure I can do this. So I talked my mom into taking my first class. She is non-medical. Guys, when I say non-medical, I mean she is non-medical. She did not want me to be a nurse. She runs from the doctor. Non-medical. But I got her through the class and she passed the test. Now, she watches that. Hi, Mom. She does watch occasionally. And she'll tell you that what you guys get is completely different than what she got because the course has evolved over 17 years. They never got any of this. They didn't get notes. They didn't even get a book. It was just me standing up there yapping. Okay. They didn't get practice tests. They didn't get any of that, but they were still successful and still passed. So how much further along are you going to be? I got 17 years experience behind me to train you. Put your faith in me. I'll get you there. Okay. Completely different than it was 17 years ago. But I take notes for you because I know what's important. Have you ever sat in a class and you're taking notes? You're just trying to write down everything they say because you have no idea what's important, right? So you're trying to remember every word they say. That is no way to study. You need to know the important points. I should be explaining why they're important. And that's what this does. But I know you're not getting 100% of what I say. You can't. You're human. You're zoning out here and there. And today is Valentine's Day. So happy Valentine's Day to everybody. So some of you are trying to figure out what you're going to have for dinner, what movie you're going to go to, right? You're trying to figure all this out while I'm talking to you about a barrier. So I know you're not getting 100%. So that's what all of these tools are for. The notes are there for you to refer back to. The video is there for you to watch. The replay from today is available to you. All of this is to help you kind of overcome your lapses when you're in class. I know it's a lot, guys. It's 4 hours and I'm talking nonstop. I don't even pause to breathe. I get it. It's a lot, but I give you the tools you need to be able to review. All right, so let's learn about barrier. So these overbed tables are used for meals. Yes, that's what they're supposed to be used for, but they're usually used for everything else. Overbed tables are going to have crossword puzzle books on them and Jell-O cups and fruit juices and cups of water and probably urinals and cell phones and all kind of chapstick and all kinds of stuff. These trays, not clean. These tables, not clean. Not even close. So that's a problem. Because as CNAs, we need a clean place to put our supplies because our supplies are clean. So if we go do our opening, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, wash hands. Now you go get your supplies. You've got those supplies, but you have to have a clean place to put them. And we know this table is not. So in order to create a clean place to put our clean supplies, we have to put something on this table to make it clean. And that's what a barrier is. A barrier is something, anything that we put on the table to make it clean. Anything can be a barrier. Anything. I can use a paper towel for a barrier. I can use a bath towel for a barrier. Anything can be a barrier. But for the test, we're going to use a very specific kind of barrier. This is called an underpad. A disposable underpad is its technical name. Some of us call them puppy pads. I'll need these shortly.
Nursing homes too.
Right? So this is a disposable underpad. But the one thing you're going to learn in healthcare is why have one name when we can have two? So everything in medicine has two or sometimes three names. We're going to get into that as we go. But this is a disposable underpad. But man, that is a lot of syllables. So most of the time we call these chucks because they're the kind of underpad that we chuck when we're done with it. That's why they're called chucks. Now, chucks have a disposable side and a waterproof side. When we put this on the table, we put it on so the disposable side is facing up. Now, this is different than this kind of an underpad. This is also an underpad, but it's not disposable. It's washable. So this is a washable underpad. Washable underpad, disposable underpad. A lot of syllables. Again, why have one name when we can have two? This is called a bed pad. Bed pad, chucks. Both are underpads, but they're slightly different. Good? We don't use this on the test. We do use these. In your book, let's see if I can remember where. It's just the one thing I don't know the page of. Page 37. You will see a list of supplies. So those of you playing along at home, I don't have this page up on my screen, but this is what it looks like in the book. It's page 37. You can see a list of all the supplies that we use and all of the names for those supplies. And if you'll notice, most of them have two names because in medicine, it's not good enough to have one. Is everybody good? Questions? So we're going to use a barrier on the table. For the test, we use a chucks as our barrier. Absorbent side up. So you'll hear that called a chucks. You'll also hear it called a barrier when we're using it on the table. Questions? So this is what we're going to use to put our clean supplies on. So we've done our opening, we've washed our hands, and then we're going to go get our supplies. Remember, you have to have clean hands to get your clean supplies. But there's a problem here. pretty big problem, actually. When I start working, my uniform is not clean. It's not. It has brushed up against the curtain. Curtain's not clean. It's leaned against the sink. That's not clean. It's knelt on the floor to do foot care or empty the drainage bag. The floor is not clean. So my uniform, once I start working, is not considered clean. So if I go get a whole bunch of supplies that I need to do a skill with, let me just get rid of this real quick. So I've done my opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain. Go wash my hands. And now I'm going to start my skill. So I'm going to go get, I got clean hands. Going to go get my supplies. So I go get everything that I need for the skill, whatever that may be. Take a whole bunch of stuff. It doesn't make any sense. But so I've got all of this stuff, right? And now I've got to spread this out on the table. My uniform is not clean, so I can't do this. Because if I've done this, what did I do to these supplies? Contaminated them. So you can't get the barrier at the same time you get your supplies. You have to do this in 2 steps. You have to go wash your hands. Just set this here for a minute. You have to go wash your hands. Go get the barrier first. Bring that over. Open the barrier up and put it on the table. And then go get the rest of your supplies and put them on the barrier.
Would you wash your hands after you got the barrier?
You don't. You don't have to because the barrier is clean. It's only one-time use, disposable. So once you take it off the supply shelf and you use it, theoretically, we're going to throw it away. For the test and in practice, we reuse them. But theoretically, they would be thrown away. Good?
So like inside the nursing home, would like the supplies be in the resident's room?
No, supplies, that's a very good question. Supplies aren't in a resident's room. Supplies are actually in a special room called clean supply. So everything in there would be considered clean. So just like there's a clean supply room, there's also a soiled utility room. So what do you think everything in there is? Dirty. Can you take clean stuff into a dirty room?
No.
Can you take dirty stuff into the clean room?
No.
No. One or the other. So if you're going into clean supply, clean utility room, don't take anything dirty in there. Okay? So usually everything is in a clean supply room. Sometimes, depending on the facility, sometimes we have linen carts in the hallway, but they're not in the patient room. Not in the patient room. In fact, we're going to learn this in just a second. Anything out of your site can't be considered clean unless it's in one of those 2 places, clean utility or the cart. So let's say, and I've got a slide on this in a little bit, but let's say that I grab too many washcloths. I need 2, I grab 12. So I brought all these extra washcloths into the room and I'm done with my skill. I got this whole stack of washcloths I didn't use. What do I do with them? Well, I can't leave them in the room for later because if they're out of my sight, they're considered soiled. Yeah. So you can't put them back because that's like an ATM machine. You can't shove stuff back in there. It's one direction only. So if I take it, I have to use it or lose it, which means it has to go into soiled. So all of those 10 extra washcloths that I didn't use have to go in dirty linen. So we have to learn our supplies. Otherwise, you're going to run out of supplies during your work environment. Okay, so we've leaned against the bed, the sink, the curtain, knelt on the floor. Clean supplies can't touch our uniform. So don't try to get your barrier when you're getting the rest of your supplies. We're going to get our barrier first. Remember, you can't let supplies touch your uniform. So we're going to wash our hands, get our barrier, put it on the table, then get the rest of our supplies and put those on the table. Everybody understand that?
I'm just confused of like, so we'll wash our hands like inside the residence room and then go to the supply room and then come back and then wash our hands?
Okay, so yes, but I know it gets a little confusing.
Yeah.
So for the test, and I need to make this distinction for you. For the test only, your supply cabinet is right there.
Okay.
It's in the patient's room. So for the test, you don't have to leave the patient room to do anything. In a clinical setting, that really is how it should be done. You do your opening, you wash your hands, and then you go to get your linens and come back. Now, the reason for that is this. You could, theoretically, before you ever go into the patient's room, wash your hands, get all your supplies, take them into the room. Okay, so you enter with all of your supplies and do your opening. But what does that tell the patient? If I'm bringing in all of these supplies and then I ask, is that okay? It's kind of telling the patient, I don't really care if it's okay. I'm coming in with everything I need. And it kind of removes your patient's ability to say no. And that's not really the image that we want to give, right? So yeah, while it's okay to wash your hands, get your supplies, and take them in the room, from an infection control standpoint, it's not really okay from a patient rights standpoint. So we really should be knocking, getting permission, closing the curtain, washing our hands, and going and getting supplies. Does that help?
Yeah.
Okay. So once we've done our opening and washed our hands, we'll get our barrier first, spread it onto the table, then go get the rest of our supplies and put them on the table. So any questions on barrier? Any questions on barrier? So we just learned another principle. So we now know skill rules. We know the opening. We know glove rules. We know the closing, and we just added barrier. Not hard, right? We're going to use a barrier anytime we're using supplies. So we're going to use a barrier for a lot of skills. But remember, barriers provide a clean place for our clean supplies. We can only touch supplies with clean hands. We can't let the supplies touch our uniform. And we're going to get our barrier first before we get our supplies. Good? Pretty easy rules, right? All right, so let's move on to privacy blanket. So this is on page, I don't know. Hold on, I'll tell you. Page 100. Okay, dignity is essential. We know this, and so is comfort. And this is why we need a privacy blanket. Renee says, hi, I finally caught a live. I test tomorrow. Thanks for the information. Awesome. Well, welcome, Renee. We wish you lots of luck on your test. Great vibes out to you. You're going to do fantastic. And welcome. So dignity is essential, and so is comfort. But we've got to pay some attention to this because your perception of temperature is going to be different from your patient's. You are active, fully dressed, running around like a chicken with your head cut off. What do you think temperature is going to feel like to you? Yeah, your patient is not fully dressed. They're laying around, not doing a whole lot. What do you think their temperature is going to feel like? Okay, but remember that you're inside your own body, so you're feeling hot. You're not thinking about how they feel. So I've got to bring this to your attention. Remember, I got 4 weeks to teach you. It's all about the patient. Okay. So closing the curtain does keep the area private for the patient. Yes. And we're going to close the curtain during our opening because that improves privacy. But it doesn't do anything to help that patient stay comfortable. Okay, private and comfortable are actually two different things. So that curtain is going to help with privacy, but doesn't do much for comfort. And we have to think about why we're closing that privacy curtain. That privacy curtain is to help everybody out there from seeing what this person has. Okay, all of you guys, if I close that privacy curtain, you guys are blocked out. But do you know who's in that space with the patient? A stranger. So I may have blocked all you strangers from seeing her goodies, but I didn't do anything to block this stranger from seeing her goodies. Remember, it's all about the patient, not you. Now, in your mind, you're like, I've seen them all. Don't really care. I'm not looking. Couldn't care less. But do you think that matters to this patient? So we have to think about this from the patient's point of view, not ours. So while that curtain is important in blocking out everybody else, it doesn't do anything to prevent exposure to the other stranger in the room, and that's you. That's what a privacy blanket is all about. We're going to use a privacy blanket anytime the patient is uncovered or undressed. So that blanket is there for two reasons. It's going to provide privacy against us, okay, so that we're not seeing everything that they have, but it's also going to keep them warm. Because think about that patient for a second. Let's look at her real quick. She's laying in that bed. She is dressed in a hospital gown and nothing else, and she's covered by a thin sheet. It's already cold in here for her. Now, what happens if I take that sheet away? Oh, freezing. So not only is it freezing, but she's a little uncomfortable with the amount of exposure that is happening here. So that's where a privacy blanket comes in. It limits the amount of exposure. I may have to expose the patient, but I'm only going to expose the area I have to for working. Make sense? It's a huge difference in minimizing exposure and just going in and doing the skill without any concern for the patient's dignity. Big difference there. So we're going to use a privacy blanket anytime the patient is uncovered or undressed. But this is something you need to know because it's not going to be on a care plan anywhere. No care plan in the world is going to tell you use a privacy blanket with this patient. This is something you're required to know. And that's what training is all about. That's what all of these principles are. The principles are not going to be on the care plan. The care plan isn't going to tell you to read the care plan. The care plan isn't going to tell you to do the opening. The care plan isn't going to tell you to make sure the patient has a call light at the end of the skill. The care plan doesn't tell you any of the principles. This is the stuff you need to know to be successful.
Isn't forgetting the privacy blanket pass or fail kind of thing?
It's actually not. It is a deficiency, but in most cases, I can't think of a case where it's required.
Mm-hmm.
Where if you forget it, that's the only thing you forget, you fail. That's called a critical step or a critical checkpoint. I don't think privacy blanket is a critical checkpoint. Okay. But it is very important. Okay. It's weighted heavily, right, but not critical. Okay. All right. So remember, it's not going to be on the care plan. We have to ensure the patient is always covered with something. But when we do this, we don't want to snap or shake the blanket. I do this at home when I change my sheets. You guys do this? If you change your sheets, you kind of do this, right? Mm-hmm. To spread it all out. Okay, do you see all those little fuzzies that just came up there? You guys see that? When you snap or shake, what you're doing is bringing all of the yeast and the bacteria and the skin cells that patient has shed right into breathing zone. Now, when I'm doing that in my own bed, I'm only breathing in my own funk. It's not that bad, but I really don't want to breathe in somebody else's, right? So we don't snap or shake anything in healthcare. We unfold. Good. Makes sense? Okay. So we're going to put the blanket on top of the sheet, not snapping or shaking it. We're just going to unfold that blanket on top of the sheet and then pull that sheet down underneath. That makes sure that the patient is always covered with something. Good. Okay. At the end of the skill, when we're ready to take that blanket off, we have to remember your patient can't be uncovered. You can't just take that blanket off and leave them uncovered. We have to pull that sheet up. But at the end of the skill, your hands or your gloves are dirty. Do you want to touch that sheet that's going to go right up next to their face with dirty hands or dirty gloves? No. So when we take the privacy blanket away, we're going to do it after we remove our gloves. Okay. Good. Questions? We're going to get into that a little bit more as we go through the program. So we've now covered privacy blankets. So another principle down. We're going to move on to linen rules, and we're not going to do page 86. We're not going to cover all of linen rules. We're only going to cover a couple here. We'll go through the rest of them next class. Notes are on page 87. And we already know this one. Linens can't touch your uniform. Remember we talked about supplies can't touch your uniform? Well, linens are a supply. So linens can't touch your uniform. We already know that one. And we know this one too. We have to have clean hands to get clean linens. That was part of our barrier rules. But let me point something out. A principle that shows up, or a checkpoint that shows up on more than one principle, right? So linens must not touch uniform. That shows up on barrier as well as linen rules. So twice. Must have clean hands to get linens. That shows up on the opening and the barrier and linen rules. Those are critical checkpoints. If it shows up more than once, it means it counts really, really big. You guys got that? Okay. All right. Principles that are repeated are doubly important. They will count against you big on the state exam. We don't shake or snap linens. Oh, we've heard that too. And then I already talked to you about this earlier. Remember that if we don't use it, we have to lose it. If we take too many of a supply, we always have to discard what we didn't use. Don't leave it in the room for later, because anything out of our sight is not considered clean. Okay. All right. We'll cover the rest of linen rules in another lesson a little bit later. So now we know everything we need to know as far as principles to learn this skill. Now we have to learn skill specific. So what makes dressing a resident, right? What are the important points of actually doing dressing? So that's what we're going to focus on now. And this is going to be in your book on page 102. So these steps that you see in the skill-specific list here correlate to the steps on the checklist. That's where I got these. So if you see it over here, it means it's a checkpoint over here that they're actually grading you on. So let's go through what they're grading us on. Okay. So page 98 are our notes here. The first thing that we need to understand is that everyone has a right to choose their own clothing. So we're going to ask the patient, what do you want to wear today? I told you about a half hour ago that this skill is going to be done on a mannequin, but we're going to talk to the mannequin and the evaluator is going to give us answers. So we're actually going to ask the mannequin, what do you want to wear today? You're going to ask. We don't assume, we don't dictate, we don't decide, we ask. But if the patient describes something that does not go together at all, like purple plaid pants and a yellow flowered shirt, does not go together, you are allowed to suggest an alternative because you are judged by the way your patient looks. If I'm walking down a hallway and I see a whole bunch of patients sitting around in mismatched clothing, that tells me that my CNAs aren't paying attention to dignity. As a family member, do you think I want to put my family member there? We need our patients to look good. We are judged by how our patients look. Your facility is judged by how your patients look. So if they describe something that doesn't go together, you are allowed to make a suggestion. How about the white shirt with those pants? That would look really nice. Now, they may say, yeah, that's what I meant. Go with it. They may say, no, I want my yellow flowered shirt because maybe it's bingo day and that's their lucky shirt. I don't know. But if they want it, they've got it. We can suggest an alternative, but we are going to honor their wishes. Make sense? Okay. So we're going to get a barrier, just like every other skill. After we put the barrier on the table, we'll go get the outfit they described and put that on the barrier. Now, when we're dressing a resident, I know we're dressing them, but we still want to minimize exposure. So that's where that privacy blanket is going to come in. We only expose the areas that we need to expose to do the skill. So we're going to minimize exposure using the privacy curtain, the privacy blanket, and by getting the clothing before we undress the patient. Imagine this for a second. You are laying in bed. Somebody has to dress you. That's awkward enough, isn't it? Right? Not real high on your I want to be here list. But you're laying in bed in a hospital gown and somebody's got to get you dressed. So somebody comes in, they pull the curtain, they throw a privacy blanket on you, and then they strip you. So you are naked underneath this privacy blanket, and then they leave to go get your clothes. How awkward does that feel? More importantly, how vulnerable do you think that patient feels being naked underneath a thin blanket in a strange place surrounded by strange people? They're vulnerable. So we want to make sure that we're asking what they want to wear and getting their clothing before we undress them. That's a critical step. Good? Does that make sense? All right. Anytime we lift an extremity, we want to lift from below with a flat palm. We're not the claw machine at Walmart, right? We don't do this to lift something. Because if you lift like this, your fingertips have to dig in, and that can cause bruising. But it also can cause the extremity to slip and fall, which can cause injury. So we always lift from below, and we support at the joints. Now, when we're dressing somebody with a weak arm, we're going to make the strong arm do all the work. Weak is weak. Means they can't move it very well. So we're going to remember this by USA first. Undress strong arm first. And then we'll dress the weak arm first. Now what that does, when you undress the strong arm first, it allows that arm to do all the work. Pull it out of the sleeve. And then the garment just slides right off that weak arm. No movement required. And then when we dress the weak side first, the garment just slides right off the weak arm. No motion required. And we're going to make the stronger arm do all the work to finish dressing. Good. Undress strong arm first. USA first. All right. When we put the new garment on, you want to slide it up carefully and don't cause injury. Oops. Remember that your care is judged based on how your patients look. So make sure the snaps are all adjusted properly. The pants are up at the waist, not under the buttocks. The toe seams are lined up over the toes. You want your patient to look good. Good enough is not good enough. Don't leave your soiled items on the overbed table, the bed, or the floor. We have to put them in dirty linen at the end of the skill. Remember, we want a clean environment. And the call light's going to go in their stronger hand because they have to be able to use it. You don't want to put the call light on the weak side. So page 103 gives us our step-by-step instructions. Care plan is at the top of the page up here. Tells us to dress the resident in a long sleeve button front or snap front shirt, pants, and socks. The resident is lying in bed and has a weak right arm. The resident is not able to help with dressing. After dressing, leave the resident in bed. Step-by-step instructions tell you exactly how to do this. Here's some practice questions to make sure that you got all the steps that are required, that you understand it, and your supply list is down here. All right. Good. I'm going to show you the video for this one because the video has good close-ups. I don't know that we're going to be able to get to range of motion today, but that's okay because we've got some time to play with a little bit later on in the program. Let's see how far we can get.
Hello, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Good. I'm here to help you get dressed. Is that okay? Okay, I'm going to close your curtain. Let me go wash my hands, get my supplies, and I'll be right back. The first thing that I'll get is a barrier to put on my table to make sure that my supplies remain clean. Mrs. Jones, what would you like to wear today? Your light pink pants and dark pink shirt? Okay. Is this the outfit that you described? Wonderful. I'll get a privacy blanket as well. Okay, Mrs. Jones, I'm going to spread this privacy blanket out over you. This will keep you warm and help protect your privacy as we do this skill. I'm going to carefully unfold the blanket, being careful not to snap or shake it as I lay it out over you. Once the blanket's in place, I'll pull your sheet down to the end of the bed. Okay, Mrs. Jones, I'm going to place your socks on now. We'll take one of the socks, scrunch it all the way up to the toe seam, put it over the foot, making sure the toe seam is lined up, lift from below and support at the ankle, and smooth the sock over the heel. Now we'll go to the other side. We'll scrunch this sock up, put it over the foot, making sure the toe seam is lined up, lift from below and support at the ankle, and smooth the sock over the heel, minimizing wrinkles. Now we'll help you put your pants on. We're going to make sure the tag is in the back. I'm going to insert one of my arms into the legs of the pants and scrunch it up so I have control over all the material. We'll then place it over your foot, lift from below, and smooth it over your heel. We're going to repeat on this side. I'm going to put my hand inside to scrunch up the leg of the pants, and then place it over your foot, lifting from below and supporting at the heel while we finish putting on your pants. Okay, Mrs. Jones. Now I'm going to lift your pants up over your hips. If I can have you raise up your hips as high as you can on the count of 3. 1, 2, 3. I'll make sure that your pants are over your hips and then cover you back up. Okay, Mrs. Jones, I'm going to elevate the head of the bed now. Please tell me when you're comfortable. And if I can assist you to lean forward, I'll untie your gown. Thank you. I'm going to tuck a corner of the blanket behind your back as you sit back. And now I'll remove the gown from this side. We're going to undress the strong arm first. Since our care plan indicated your right arm is weak, we'll undress your left arm first. I'm going to the other side of the bed now. Okay, Mrs. Jones, I'm going to undress this arm. Being careful to minimize the movement and support the arm at the elbow as I lift it off the bed. We'll remove the soiled gown. We'll go ahead and rest your arm back on the bed. Okay, now I'm going to assist you with your shirt. I'm going to scrunch up the arm of the sleeve and put my hand through backwards, keeping your arm supported on the bed. I'm going to lift your hand and hold it as if we're shaking hands. This will keep all your fingers together as we place the sleeve over my hand and then over yours. Once we have the sleeve in place on your arm, we'll extend your arm out. I'll support at the elbow as I bring the sleeve the rest of the way along your arm. If I can have you sit forward, Miss Jones, let me assist you. Thank you. Make sure that you remain covered and smooth the shirt along your back. Come on back, Mrs. Jones. Thank you. Okay, Mrs. Jones, I'm going to assist you in putting your other arm in your sleeve. So I'll scrunch it up, put my hand in through backwards. And Miss Jones, if I could have you reach your arm up and back for me. I'll assist you to put your arm in the sleeve. Okay, Miss Jones, we'll rest your arm back on the bed now while I straighten your shirt and make sure that it is snapped appropriately. Okay, let me just adjust your clothing to make sure it's neat. Can I have you lean forward for me, please? Thank you. And I'll make sure that this blanket can be removed. Okay, Ms. Jones, I'm just going to gather up your privacy blanket and place it in soiled linen along with your gown. I'll be right back. Okay, Mrs. Jones, I'm just going to adjust your clothing for neatness and appearance and make sure that it's fastened appropriately and that you look good. Very nice. Okay, you have your call light here if you should need anything. Can I get a magazine for you? Okay, I'm just going to throw your barrier away and open your privacy curtain. Now we'll go wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections, and then tell the evaluator my skill is done. All right, any questions on that?
You really copy, we really do that the way you talk.
Mhm.
Oh, okay.
So everything that I say, notice that it's not for me. Who's it for?
The resident.
Yeah. So remember that they don't know what you're planning on doing next. And you're doing it on their body. So they have a right to know what's coming next. So saying everything I say is kind of important for the patient. Not for us, not for the test, but for the patient. It'll also, for the test, help you remember your steps. Now, you're not graded. There's no checkpoint that said everything Miss Patty says. Okay? No checkpoint says that. But you are graded on communication with the patient.
They said it's better to say everything than not say anything at all.
Right, exactly. Remember, if you were the one in the bed, what would you want to know?
Everything.
If somebody's going to be taking your sheet off, what would you want to know?
Everything's
Yeah. Otherwise, you're probably going to be ducking and covering and,
swinging.
because you don't know what's happening. You don't know what's coming next. They're vulnerable. They're dependent. So we've got to make them comfortable by telling them every step of the way. All right. Any questions on this? All right. We do have another skill that I'm not going to be able to get to today because it's range of motion. It's actually a very, very easy, simple, quick skill. It's like 2 minutes, but I know that I've only got 2 minutes. So you can see that's it. That's all the slides there are on that one. So we will get to that next class. Remember that you've got wrap-up emails. So you'll get a wrap-up email from today that tells you, has links to everything that we covered as well as the replay. If you haven't accepted the invitation to join the online course, you'll want to do that. And then I'm going to give you your review sheet for today as well. If you fill these review sheets out as we do them in class, they become a very effective review packet right before you test. They're very helpful. And also, these are questions, fill in the blanks. The back are the principles that we learned today. So it's a great way of being able to review all the principles.
I watched your videos my first time go around.
Oh, did you?
Yes, ma'am.
Very good.
My sister actually told me about you.
Oh, nice. Nice. Yeah, we're pretty well known. All right, so that's going to wrap up for today. Remember that we do have CPR on Saturday at 9 a.m. You don't have to pre-register. Just show up. It's only $45. You'll get your certification that day. Plus, you get a coupon for the scrub shop for 15% off. So that's a huge savings as well. So Saturday, 9 a.m., just show up. If you can't make it this Saturday, your next opportunity is week 4, Monday after class. So 2 to 6. Again, $45. After graduation, the price goes up to $55. Okay. Have a great weekend. Happy Valentine's Day.
That like March 6th or something like that.
I'd have to look it up. I don't. Yeah, it's week whatever week 4 is. I think it's actually March 4th because I think you guys graduate on the 6th.
Oh, okay.
So I think it's March 4th. All right, guys. See you Monday. Have a great weekend. Remember, we've got 2 chapters of homework. Chapters 2 and 3. So read chapters 2 and 3. Take the test in the white book on page 182, 183, and grade them before class. Have a great day.